America Foundation. My name is David Gray. On behalf of our Next Social Contract Initiative, it's my pleasure to welcome you to our discussion on social policy after the economic crisis. As part of our Next Social Contract Initiative, our various domestic policy programs are working to develop ideas to update our social programs in light of the changes and challenges of the current century. And as you know, the changes and challenges have come fast and furious over the past few months. The challenges in our economy this year have come at a dizzying rate, with some industries which just a few months ago were earning record profits are now laying off record numbers of workers. We're holding this event today on what the U.S. Department of Labor calls Numbers Day, and the numbers today are not very good. In November, employers shed more jobs than at any time in the last 34 years. And so the needs of American workers, families, and employers are great. And our social safety net is fraying, and President-elect Obama and the new Congress have their work cut out for them in developing programs and policies to jumpstart the economy in the face of a $1 trillion deficit and of more than $10 trillion national debt. And so our government must be creative in its response, and that's what we're here to talk about today. First, by way of housekeeping, we have an overwhelming response to this event, and so you, by coming here early, get both a seat and a lunch, and we're grateful that you've joined us today. There are packets about our foundation and our programs with articles from some of our speakers outside. We're grateful that so many members of the press are here today, and we look forward to their questions. And we welcome those many people who are joining us over the internet as we're broadcasting this live. Today we have 3 panels to talk about entitlements, the American workforce, and health care. And we are also looking forward to both our panelists and to your questions. First, to start things off, I am pleased to welcome a good friend of the New America Foundation to be our keynote speaker. Karen Kornbluh came to New America a few years ago as a technology fellow after serving on Capitol Hill, in the Treasury Department, and the Federal Communications Commission. And while at New America, Karen founded our Work and Family program and helped develop new language that we in the work and family field use in talking about the needs of working families. Karen served as the policy director in the office of Senator Barack Obama, and this past summer was the primary author of the 2008 Democratic Party platform. Karen joined us here in August to help us understand and explain and preview that platform, and we are grateful that she has taken time to be with us today to set the context for our panels to follow. So please join me in welcoming Karen Kornbluh back to New America. Karen.
Thanks so much. It's so nice to be here. I was trying to think of a joke about social insurance, but I couldn't think of one. Sorry. It's great to be here at New America. It's great to be following David, who's done such amazing work on the Workforce and Family program and really taking it in new directions and redefining what family values are really all about. So I'm really flattered to be here. And I just wanted to tell you I had this fantastic experience this past summer, which seems like 100 years ago, when I got to write the party platform. And we did hearings all over the country. There were, even though there was only sort of a week that we gave people notice that they could do this, and then they only had a week to organize them, there were 1,600 platform hearings across the country, and 30,000 people participated. It was really pretty amazing. And I had got to read through all those and, you know, cull out what people thought was important. And fans of New America will be very pleased to know that what wound up in the platform sounds remarkably familiar. So if you just listen, we have the first section of the platform is called Renewing the American Dream. I always have to read from it because I want people to read the platform, and I have you captive, so I'm going to do that now. So the first section is called Renewing the American Dream, and the first section of that is Empowering Families for a New Era. And, you know, this is really what people felt. People around the country really felt like there was a basic bargain in America, and they loved the New Deal, but the bargain wasn't really holding up right now. And they wanted to get a way back to figuring out how you could get into back to a situation where between the American government and the American people, or as I like to say, among the American people, there was this bargain. We were going to be there for each other in times of need. So it says, many Americans once worked 40 hours a week for 40 years for a single employer who provided pay to support a family, health insurance, and a pension. Today, Americans change jobs more frequently than ever and compete against workers around the world for pay and benefits. The face of America's families is also changing, and so are the challenges they confront. Today, in a majority of families, all parents work. They're members of a new sandwich generation. They're working longer hours than ever, while at the same time having to meet a new and growing set of caregiving responsibilities. Our government's policies, many designed in the New Deal era, have not kept up with the new economy and the changing nature of people's lives. Democrats believe that it is time for our policies and our expectations to catch up. From health care to pensions, from unemployment insurance to paid leave, we need to modernize our policies in order to provide working Americans the tools they need to meet new realities and challenges. So I think, all of you have been working on this, and especially the folks at New America should feel really proud that, this concept that you've been pushing was such a part of the public debate during this election. So what I'm going to talk about today, while we're on the transition, we're not allowed to talk about transition at all. We're not allowed to talk about the new administration. We're allowed to talk about things we worked on before. Fortunately, while I was at New America, I did research for an article that came out in 2006, and I get to just keep talking about that all the time. So there are 3 points that I wanted to make. One is social insurance is social. The word social is in there for a reason. The second is that the New Deal isn't new anymore. And then the third one is that the way we're operating right now is cheating the future. So those are the 3 big points I'll try to make pretty quickly. And what I mean by social insurance is social is that in the early 1930s, when we put together what we think of as the New Deal, in addition to this economic crisis, there was we were living through this transformative economic period, as David was saying, where people had moved from the farm to the city. They were now dependent on a single wage earner to support the family as opposed to working in a farm. The extended family networks had broken down because people were in the city. And because of public health changes, life expectancy had grown. So just as we're living in this transformative era now, and there are these long-term changes that we're dealing with now at the same time as we're dealing with a very immediate economic crisis. It was very similar back then. Immediate economic crisis, but there were these longer-term trends that were really transforming the way people lived and worked. So the Social Security Act of 1935 was really designed to address some of these longer-term issues and the falls in income that could result from the retirement of the single breadwinner, from widowhood, or a cyclical downturn. And so you got Social Security retirement benefits, you got unemployment insurance, later on disability insurance and aid to dependent children. And what I mean by social insurance is social is that some people tend to think of our social insurance programs as just being about an individual saving to smooth out their own cash flows, So you're saving for your own retirement, but the government is forcing you to do that, or you're saving for your own period of unemployment insurance. But actually, from the beginning, it was always designed to be much more than that. So not only was it progressive, meaning if you were lower income, you got more out, and if you were higher income, you got a little less out than you put in. But from the beginning, before it went into effect, there was always this family component to it, where, for instance, if you were married for 10 years, there's a spousal benefit, which is not insignificant. It's 150% that you would get as a married couple in retirement, as opposed to 100% if you were not married. And that was intended to be for the dependent spouse and children, of course. And there's also the survivor's benefit, which is meant to be there if the breadwinner died. So there were always, and then there's the aid to dependent children. There were always these features of it that were not just about an individual saving for himself, but were about making sure that families would be secure even when there was an interruption in this income. And even today, the National Women's Law Center finds that 50% of people receiving Social Security benefits actually collect these benefits as either a widow or a widower, spouse or child of a worker, or a disabled worker, rather than as an individual receiving Social Security benefits based on his or her employment history. So that's what I mean by social insurance was always social. And what do I mean by the New Deal is not new anymore? Well, obviously, the Social Security system was incredibly important. It's reduced poverty among seniors dramatically, as well as we were saying, dependents. But as we all know, the workplace has completely changed. The family has completely changed. Just some statistics, workers are employed in non-standard positions, as Michael Calabrese taught me, temporary, part-time, freelance, contingent, day labor, and so on. They change jobs on average every 5 years. They're unemployed for longer periods. They're less likely to be offered defined benefit pensions or sufficient health insurance. And if they're lucky, they get a 401k and meager health coverage. So and then there's dramatically rising inequality. So the workplace has completely changed, and as you know, the family has changed, so that today 70% of all families with children are either headed by 2 working parents or a single working parent. A third of children, this is the statistic I can't get out of my head, a third of children today in America are being raised by a single parent. 60% of children in poverty are being raised by a single mother. So it's a really different situation, and not always because of divorce or widowhood, obviously. And the social insurance system just isn't set up for this. So health insurance, which I'm sure others will talk about, is upside down, as New America has always said, and totally inadequate. So in other words, if you have a better job, if you have a higher income, you're more likely to get health insurance, and you're more likely to get benefits from the government through the tax system than if you're lower income or you have a less good job. Pension, similar situation. Social Security, we don't think of in those terms because it doesn't go through the tax code and it doesn't go through the employer, so you wouldn't think it would have those problems. But because it's gone through the breadwinner as a proxy for getting to the dependents, it has some of the similar problems, and because it's so keyed to earnings as opposed to in other countries. So that means it's much more generous to a stay-at-home, let's say a stay-at-home spouse who has no kids and never works a day in her life than to that single mom who's raising those children in poverty. She's likely to get much less money in retirement, actually, even though she's worked her whole life, paid into Social Security her whole life, and brought up a child who's going to help support us all in our old age. It's also much more generous because of the way it's structured to a family that's much more like the Cleavers than like Roseanne and Dan. You know, it's much, if you have a single breadwinner who's at a higher bracket because it's so geared to earnings, you're going to get more in retirement as a family than if you're two more equivalent wage earners. And Jean Sterling has done amazing work bringing out the statistics. One of them is a single head of household who works for $20,000 a year for 40 years and raises her children will get lifetime benefits of about $95,000 while paying taxes of $50,000. Whereas a non-working spouse who doesn't raise children but happens to marry someone making $100,000 a year will receive about $250,000 in lifetime benefits and pay nothing in taxes. So this New Deal is not new so much anymore. And what are the results? About a fifth of all women age 85 and over still have income below the poverty level, in part because they live longer, in part because of their earnings history, but it's also exacerbated by this Social Security system. And women, in fact, received average monthly retirement benefits of $826 in December 2004, while men averaged $1,077. So just some of this sense that it's not, if the point is, in fact, to be social, if the point is, in fact, to support people who are raising our next generation and to keep people out of poverty, it just needs to be restructured. And when you look at the unemployment insurance system, it has problems of its own that are different from the health insurance system, the pension system, or the Social Security system. And you see that only a third of eligible workers receive it because the jobs aren't properly classified, because it's keyed to how long you've been in the job, because you can't take it for family reasons. So unemployment insurance, again, is another piece of the social insurance system that's not new anymore. And if you look at what other industrialized countries have done, you see that they have tried to update their social insurance systems, either because they started out more universally and more keyed to keeping people out of poverty and use less of this ruse that it was all tied to earnings, or because they've actually updated it for the way the families live today. So they'll have a minimum benefit guarantee to keep elderly out of poverty. They'll have, as well as an earnings-related benefit. They grant credit towards the earnings-related benefit for time spent away from the labor force, and so on, so that as a result, we have higher poverty rates here than we do see in other industrialized countries. And then European countries have also provided family allowances that we don't have here, just to help families pay for the cost of raising children. And then they also now have the right to work flexibly and also paid leave that we don't have. And so that's what I mean by the New Deal not being new, especially here. And then the third thing I wanted to just quickly say is that the result of our current system is that we're cheating the future. And that's why we have to take it really seriously. It's not an abstract intellectual exercise. You know, we're at a think tank. People do a lot of thinking and writing reports, but this is incredibly important to the daily lives of people out there. And even though we're going through an economic situation right now that requires urgent attention, this is not the kind of thing that we can just ignore and let sit there, because we're really cheating our future. And just one way to think about it is that in the 21st century, it's a knowledge economy. And so parents are really producing, families, if you will, are really producing our capital for the next generation. And because it's the human capital, it's the children. And they are not being supported. And they're going through these terrible cycles of economic insecurity because their wages aren't rising, and then when they have these interruptions, they don't have the cushion, and the social insurance system isn't there for them. If we really wanted to address that, what we would do is take a look at income replacement that really makes sense for the current economy, and that we'd see that parents, whether mothers or fathers and other caregivers, would actually be supported when they were taking time out. So or when they had these other interruptions. So what are some things that would make a big difference? Obviously, health insurance is the biggest issue, and I'm sure we'll do a lot of talking about that here. Yes, and New America's made such a huge difference in that debate. And one of the things that was wonderful about working on the platform, actually, we'd spent the primary fighting over the 5% of disagreement that people had over how to reform health insurance, and it seemed so big and insurmountable. Then we came together to work on the platform. It was a great exercise to be able to sit down and work on some language and have something really productive to do together, and we remembered that 95% of the things we agreed on. And so actually the strongest part of the platform, I think the longest part of the platform, is the health insurance piece, and we had everybody was so happy with it, whether it was the single payer folks, mandate folks, people who were on all sides of the debate, were thrilled to see that we were all committed to making sure there was health coverage for everybody, that it had prevention in it, that it had chronic care management, and so on. So I think health insurance reform is obviously, the biggest thing we can do on the social insurance front, and it's something that I think there's a lot of impetus behind. We can't take it for granted, obviously. And then Social Security reform that I've talked about a little bit, who knows when that's going to happen, but I think whenever we do come to look at Social Security reform, Social Security modernization, we should take a look at some of these issues that Gene Sterling and others have talked about. How do you reframe it for the new family? UI modernization is front and center in terms of what the Hill is thinking about. And then I would just throw out there some kind of new family insurance scheme. And that's just a fancy way of saying we should look at paid leave and expanding the Family and Medical Leave Act in a bigger context, not just think of it as like a sideshow, but as updating our system for smoothing out incomes. And that if you think about it in family insurance, then you would do things like make sure that if a parent is sick, if a child has to care for an elderly relative, that they don't have to go off to bankruptcy court because they've lost all their income. And there are lots of different ways you could do it. Both Hillary Clinton and Barack Obama had proposals during the campaign to work with the states so that they could create new systems of paid family and medical leave. You could do it at a federal level. You could do it very broadly. You could make it available to people who work part-time. You could think about ways to do it at all stages of life. So I would just throw that out there and think of it in the context of broad social insurance reform's approach to family insurance. I know there's going to be a very exciting set of panels today that are going to talk about a whole host of issues. I haven't really talked very much about pensions. I know that's going to be a major thrust. I'd just say that I think we're in one of those moments. I remember Ted Halstead, who founded New America. At that period, we didn't feel this sense of urgency that we feel now, and I know he was always warning us to get ready. So when the country was in a situation where we were at war, where we had an economic crisis, we'd be ready. Well, we're in that moment now, and I think all the work that everybody has been doing, thinking about how we'll address some of these issues, I think the spotlight is on, the willingness to do things is on. And I think it's very exciting that people are coming here together to figure out what our next steps are going to be. So thank you very much.
Thank you very much, Karen, both for talking about the importance of the moment and also some of the principles and context that we will discuss today. I'd like to call Michael Calabrese and the entitlement folks forward for the next part of our presentation. Thanks. Michael.
All right, thanks, David, and thanks, Karen. That was great. We were very sad to see Karen leave New America, but as it turned out, we made a wonderful contribution to the country in the process. So this is and I'll have my colleagues join Mark Avery up here. This is the entitlements panel, and we will. We're going to try to do this in a bit of a lightning round fashion almost, because we're packing in a whole lot today. When you think about entitlements, at least what leaps to mind most quickly is Social Security and Medicare, and we'll be addressing that. These programs, of course, guarantee a very basic level of health care and retirement income for older and especially retired Americans. At the same time, we have a president. It's interesting to contemplate that we have a president-elect and an expanded Democratic majority in Congress that has also effectively promised new or expanded entitlements in the form of universal health coverage and more help for retirement savings, such as expanding the Savers Credit, which I think Mark Every will touch on. So when we think about how is the current economic crisis going to, complicate this picture, there's really, two challenges or conundrums even that sort of come to mind that I'll just throw up as fodder for the discussion that we'll have and the questions that you might have. First, early in 2009, of course, the short-term policy priority will be economic stimulus, which is going to be mainly about stimulating spending. And yet, our evolving retirement security crisis is a problem of too little saving, right? Too much spending. We need to find ways to incent and stimulate new saving by middle and lower income workers. So that's an interesting conundrum. Similarly, overhauling our healthcare system must be grounded in slowing the growth of healthcare spending. So reining in costs and making the system more efficient, as Len always emphasizes, is equally important to expanding coverage. And the second, perhaps, conundrum or consideration is that both the current fiscal crisis, and the efforts to expand entitlements for today's non-older workers, right? So more healthcare coverage, more retirement saving. This is also happening in a context of a much longer term and deeper imbalance in what you might call the older entitlements, Medicare and Social Security. So we have this unfolding economic crisis and this longer fuse fiscal crisis in our more traditional entitlement programs. So with that as a backdrop, when we get the panel right up, they will each speak up to and no more than 10 minutes, and then we'll open it up for some discussion, questions, and if you do ask a question later, please identify yourself. Let me just introduce each of them because there's actually bios in your folders, so I won't need to say too much, except that Len Nichols directs the Health Policy Program here at the New America Foundation. And Maya McGinnis is the president of the Committee for a Responsible Federal Budget, which is housed here at New America. And her other hat is as director of the Fiscal Policy Program, which does budget, tax, entitlement, and other related work. And then Mark Every is actually also a person of many hats, currently a non-resident senior fellow at the Brookings Institution, where he helps to direct the Retirement Security Project. He's a research professor at Georgetown University, of counsel to Sullivan and Cromwell in his spare time, and formerly served as benefits tax counsel at the Treasury Department from '95 to 2001. So Len, we'll hand it off to you.
Well, thanks, Mike, and I appreciate those introductions. I think Mark might be the only person in Washington who has more jobs than Maya, because I didn't know you had so many different things going on. Let me begin by being a bit of a curmudgeon and objecting to the title of this section of the thing. Entitlement. Entitlement is a deliberately pejorative word that was invented by libertarians in the 80s, and it was chosen very carefully, I'm sure they focus grouped it, to prejudice taxpayers against expensive programs and the beneficiaries thereof. Now, in fact, our mandatory spending programs, go back and look, it was Murray Wiedenbaum, our mandatory spending programs, Medicare, Medicaid, and Social Security, represent promises. Promises we have made to the most vulnerable among us, and thus are in many ways our most sacred social contract. Now, in fairness to the libertarians, it's fair to say they were probably just unaware of the scale of human need at the time, and that was because it was largely hidden, let's be frank, and it was hidden in hospitals. Hospitals, before we had Medicare and Medicaid, hospitals were aware of it, which is how we got Medicare and Medicaid, because they came and said, you know, this is getting overwhelming. So I think it's fair to say they were excused. Some people today still suffer from a lack of awareness of the scale of human need, and I would submit it's less excusable in today's world than it was, but I'll leave it at that. Now, fairness also suggests honesty, so let's be honest. Some of our most strident critics of our promise programs really don't like social solidarity and social contracts. But we should also be honest that some current beneficiaries aren't really vulnerable either. That is to say, we need to reconsider our social contract in a very serious way and redefine it as we will going forward. But let me be crystal clear at the outset. Redefining our social contract does not mean throwing up our hands in despair and concluding we just can't afford human decency for a growing share of our population. We're sorry. And it's also true that redefining our social contract in total does not mean literally just focus on what subset of current beneficiaries we might be able to continue something for. It's really about doing everything Karen said. It's really about thinking about what we really want our society to do, and I'll come back to that a little bit later. But I would say you're going to hear some about insurance expansion options from my colleagues Julie Barnes and Elizabeth Carpenter in the health reform panel later. I'm going to talk about Medicare. So while we're being honest, let's get some facts on the table. And I think it's fair to say that in Washington there are facts, and then there are things that CBO says. And when CBO says it, it's a super fact. So when Peter Orszag began to say, which we wholeheartedly endorse, we don't have an entitlement problem. We have a health care cost growth problem. That is in many ways the most profound fact of this discussion. This affects Medicare and Medicaid, and I'll be glad to talk about Medicaid as long as you want in the Q&A, but it's such a special case. I'm going to focus on Medicare because truly what drives Medicare costs drives Medicaid costs over time. Over the last 3 decades, one of the fundamental problems is that Medicare cost per capita has grown roughly 2.5 percentage points faster than per capita GDP. Another way of saying that is it's growing faster than productivity. And this is the problem. Health care is claiming a larger and larger share of our national output. Now, a growing share of output is particularly problematic in a demographic situation where the number of workers to beneficiaries is also declining. Those two things going on, cost per person going up and worker per beneficiary going down, it follows as the night the day. Either benefits have to be slashed or taxes have to be raised. Or you have to find some colonist somewhere to send you money. I'm in favor actually of having immigrants be pregnant engineers. We'll just bring them all in, produce babies, and life will be better going forward. But the key to unlocking this puzzle really is to notice that our healthcare system suffers not only from a bad cost trajectory, but from a stunning level of inefficiency at any given moment in time. People a whole lot smarter than me, National Academy of Systems Engineers, various academics across the country, we could name them, have concluded with great, I would say, certainty and consensus about 1/3 of what we spend in healthcare does not add clinical value added, does not add clinical value, does not improve health. Now think about it. We spend 16% of GDP. So if 1/3 of it is not doing anything, that's over 5% of GDP we are, in some sense, wasting. Just as an aside, it would cost 1% of GDP to cover everyone. So stand there and tell me we can't afford this. What I will say is the key to lowering cost growth in the short run is reorienting our delivery system to root out this wasteful spending. Let me be clear, all of us who do this for a living know this will not be easy. One human's cost is somebody else's income. They will defend it. But partly for that reason, Medicare can't do it alone. At the same time, the rest of the system cannot do it without Medicare. Medicare and the system are inexorably linked. Medicare is the single biggest buyer. So Medicare reform has to be part of system reform. And the good news, sports fans, it is. Look at what President-elect Barack Obama proposed on the supply side of his. Everybody talks about coverage because that's where all the excitement is, but you look hard at that white paper that just laid out the program, and you will see a tremendous similarity to what Senator Max Baucus just proposed, to what Senator Kennedy is talking about, to what Wyden and Bennett have, to what Wasserman Schultz in the House, Stark, Chairman of Ways and Means, Wendell Primus, top aide to Pelosi, I heard him last night say the exact same set of things. You cannot do coverage without cost growth. You cannot do coverage without value enhancement. You cannot afford any of this in 10, 15 years unless we bend this cost curve. And therefore, figuring out how to use Medicare as a catalyst for system reform and vice versa is actually a thing most of us are spending a lot of time on. Now, it is true, history will show this out, some politicians in both parties have been, shall we say, reluctant to take on the provider lobbies, which have been impressively effective. I think the most stunning success here is if you look at the Durable Medical Equipment Trade Association, I forget the name of it, it doesn't matter. They have a little press release when they won their last victory stopping competitive bidding in Medicare. They said, I'm not making this up, one of the bullet points, competitive bidding is anti-competitive. Now let me tell you a secret. You got to wake up early in the morning to convince yourself that that is true. Got to be way smarter than me to pull that off. But it's also true, and this is the good news. Most Democrats and a critical mass of Republicans do want to figure out how to get all Americans covered. They do want to figure out how to preserve Medicare's essential promise, and that these goals, and they agree, these goals cannot be achieved without delivery system reform, and therefore that's what this is all about. So I would say one way to think about the coming, if you will, grand bargain is this. Covering all Americans is the price that liberals are going to demand to acquiesce to what will have to happen to the delivery system to make it possible for us to make universal coverage sustainable over time, universal coverage and the Medicare program over time. How? Largely by beginning to build on what Medicare is doing right now. They are turning into a value for purchase purchaser and tying payment to performance. There are good experiments going on out there. A lot of it started by the Bush administration. I give Tom Scully and Mark McClellan high marks in a lot of ways. And I would say what we got to do is turbocharge those experiments with system-wide reforms led through Medicare experiments. What are the pieces here? Health information technology, which will probably be in the stimulus package because it is a long-run investment that should pay off if we do things smartly with it. But you can't just do information technology alone. You got to have both decision support tools so every clinician patient encounter has access to good information. You also have to have incentives. You've got to change the way we pay. The fundamental thing that's wrong in our healthcare system is our incentives are misaligned. It comes down to payment reform. I know I'm an economist, I'm a little bit territorial about that, but I will say it does come down to money, and it comes down to incentives. So if you link incentives with information, you can do better. And again, the good news is the major congressional support agency that advises the Medicare program, MedPAC, Medicare Payment Advisory Commission, has said, and I quote, this is almost a fact, not quite CBO, but it's almost a fact, it says the fee-for-service business model has to be phased out. It's obsolete. We have got to move to more bundled pricing. We've got to move to way smarter ways of buying. And that's what all this payment experiment stuff is about. Comparative effectiveness, which again, the President-elect supported, Senator Baucus has a bill, the House has a bill. We're probably eventually going to also have to think about more serious income-relating premiums. I have no problem with that in the long run as part of a grand bargain. I do think, though, you want to be careful not to dismantle the common risk pool. The whole point of insurance, and certainly social insurance, is to make the risk pool as effective as it can be, and that means it's got to be large. Now, implementing all this it has a point. The point is to enable us to buy smarter, which is another way of saying the language I prefer to use. It allows us to exercise stewardship over our health care resources, indeed, our social resources. And why do we do that? Oh, sorry. Why do we do that? because the phone rings. We do that because we want to enable all, as Karen said, all our citizens to participate in the life of our community. That's what makes social insurance real, and that's how Medicare will survive. Thank you very much.
Hi, thank you everybody for coming today. Okay, I'm going to have to admit that Len's first sentence threw me for a loop because I had no idea that entitlements was a poll-tested libertarian word. So I've quickly gone through my remarks, scratched out like every other line, and will try not to use the word entitlement. But it does remind me of a, I think, slightly amusing story, which was like 7 years ago, a cruel hoax was played on me where I was told that I was being interviewed for a TV show. And secretly, they were poll testing my remarks. So if you look in my office, there's a picture of me like happily smile talking to cameras and lines just plummeting. And it turns out that the reasons they were plummeting is that two things, the word entitlement and the word actuarial balance, not popular in speaking. So it's a good reminder to take those out of my remarks, and I will try to cleanse them completely. I think the program we're doing today is immensely important because everything that's going on in the economy right now is revealing the cracks in our social insurance system. And yet the immediate pressures to deal with the economy, this is not where we're focusing. We're focusing on industries, we're focusing on financial issues, we're focusing on stimulus and a macroeconomic level, but this has to be one of the next discussions. All the risks and vulnerabilities that people in our country face today and whether our systems are set up properly to deal with them. So starting with the economic recovery system that we're going through right now, what we're looking at going forward is absolutely massive. We recently estimated that it's likely to be $1 trillion budget deficit that we face next year, and that was before we noticed that the stimulus proposals seemed to be increasing by, tens, hundreds of billions of dollars a week. So I actually think the $1 trillion deficit next year is a conservative estimate. And this poses a real tension for lawmakers because what they need to do is spend all the money that's necessary now to stabilize the economy. And quite honestly, nobody knows exactly how to do that. We're going to make a lot of mistakes and we're going to waste a lot of money, but it's going to take a lot of money to put the stimulus into the economy that's necessary. But at the same time, they have to walk the fine line of realizing that on the other side of this, once the economy starts to recover, we're hit with mounds of debt. And you want at the same time that you're stabilizing the economy to reassure financial markets that we're not going to have the next big bubble, going from a stock market bubble to a housing bubble to a government debt bubble. And so I think what what President-elect Obama has said is absolutely right, that we need to take all the measures now to deal with the economy. But on the other side of that, we have to go line by line and think through the budget, how we're going to pay for or deal with all these fiscal pressures we have. And it's right in line with what the Committee for a Responsible Federal Budget has been saying. We've suggested that any stimulus package also include a mechanism to deal with longer-term issues, whether it's a working group or a promise to have a budget plan out there in 18 months. And what we're doing right now is trying to develop a fiscal roadmap to guide our way through the current economic downturn, the long-term fiscal challenges we face. The problem, of course, with going through the budget line by line, an example that President-elect Obama used is it's not just going to be millionaire farmers that pay the price for what's going on right now. We're going to have to fundamentally rethink how we spend our money, and the largest place that the money goes is into not entitlements, but mandatory government spending. Can I use that? Okay. To mandatory government programs, which take up about 2/3 of the budget. That's where the real money is, and it's not going to be able to be ignored when we rethink the budget. I actually think that the economic crisis, it's bad. There's a lot of bad that goes with it. You can't put a lot of, upside on this. But there is an exciting possibility to make what we have to do as transformative as possible. And I think that holds true both for the stimulus that we're looking at now and the long-term fiscal issues that we have to come to terms with. So how do we do that? In terms of stimulus, we're not looking at the traditional measures that have been most useful, things like temporary tax rebates and food stamps, and nothing beyond that. We have the opportunity, because we actually need to spend so much money, and believe it or not, it's hard to spend $300, $500, $700 billion, to make sure that we target that money to things that are investments in that they will provide higher returns in the economy in the long term. There are a lot of ways that we need to spend money because there are a lot of pent-up demands in our economy, and investment has been shortchanged for numbers of years. And the opportunities right now to put more money there are very useful. We are proposing that when you do put in new money in kinds of investments, We also have offsets for that spending that you wouldn't put in now. We want to borrow all the money now, but once the economy has stabilized, you do need to find ways to offset the cost. So we're going to be looking at things like, are there ways to put a lot of money into green technologies now, but offset that with something like an energy tax that triggers once the economy has stabilized? Can we put a whole lot of money into the kinds of investments in healthcare that Len and his team are looking at, health IT and other things that we think will save money over time, but make sure that those costs are recaptured after we put them into place, and so that they're not permanent new spending items. We also have the opportunity to make the fiscal reforms and the mandatory programs transformative as well. So there will have to be a major budget deal when we are through dealing with the economy as it stands right now. And it's hard to get rid of the word mandatory spending.
For 3 more days. It's okay.
Mandatory. You know, I have to say I don't feel like an evil libertarian when I'm saying the word. It's just in my head. But mandatory spending will certainly be at the center of any budget deal because that's where the money is. My personal belief, and I've written on this in the past, is that we need to think about this in a bunch of different ways. We first need to think about what the unmet needs in our country are, and I would list certain things like children, the changes that have resulted from globalizations, the new risks that we're seeing now from a volatile economy, many of the issues that Karen Kornblue was talking about in terms of family issues, modernizing our social insurance system. I would also talk about the need for more individual responsibility. We have focused so dramatically on individuals borrowing in the past decades instead of saving. I think we need to look at new dramatic forms of individuals saving for the kinds of needs that we know that they will meet in the future. I also think we need to have a more progressive role for government. I think when there are unlimited resources as we have now, it's important that where government focuses its resources is on those people that most need them. So particularly, I've written about things like mandated savings for things that we know will happen, like retirement and basic health care, matched with progressive matches to help people low income and who are particularly vulnerable. Real insurance, so that we have insurance that pays out when you need it, not regardless of the actions that happen. You don't insure your house for cleaning gutters, you insure it from when it burns down. So real insurance like that. And then government reinsurance of all sorts of programs. We've seen that the government actually does reinsure almost all parts of our economy. Well, I don't think it's right for it to reinsure financial sectors, you know, to make sure that you get good on the upside, but we all pay for it when it's on the downside, but not do the same things for individuals and their kind of financial security. So I think that the underpinnings of an updated mandatory spending system would help with things like it does now with health and retirement, but also wage security, long-term care, structural unemployment, and housing, many of the issues that are not currently covered that need to be. So I'm going to end where I actually think the national discussion should begin, which is some of the fundamental questions, because what I think of how it should look is not, you know, necessarily right at all. But we need to figure out a way to have national discussions about making big changes, because what was going to have to happen, given the fiscal realities of the budget, is not just incremental changes. So I think we need to think about things like, what needs do we need to focus on? Right now we focus through these programs primarily on health and retirement for seniors, less for workers and children. Is that the right mix, or do we need to rethink some of that? When should a program be universal, where everybody gets benefits, and when should it be targeted, where it's based on need or events that occur? When should we focus on income support, meaning keeping you at the income level to which you are accustomed to, versus creating safety nets so that nobody falls below a certain level, excuse me. And then what kind of options we use for structuring these programs? There's all sorts of options. There's individual and government partnerships. There's the role of employers that we're currently grappling with. There's saving versus social insurance versus targeted insurance. And there's things like tax incentives versus mandates versus vouchers. There are all sorts of structures. We need to be able to rethink which the most appropriate for our goals and our current economic conditions are. So I think it's just appropriate to say that no matter what, no matter how you feel about these issues, these things are going to change. The fiscal realities that we will face and we will start to deal with after we've dealt with this terrible economic situation we're currently in will demand dramatic rethinking. And so I'm hopeful that that discussion will start taking place as quickly as possible. And I've always been really lucky to work at the New America Foundation, which I think has taken a real lead in starting that discussion. Thank you.
I'm Mark Every from Brookings. I love to listen to Maya and Len. I'd almost rather just do that than take 10 minutes to talk myself. But Michael's asked me to do that, and I'm really happy to be here at New America with Karen and Maya and Len and Michael Calabrese, Ray Bashar, Reed Kramer, Melissa Coity, and others. New America does fantastic work. And I think you all recognize that, but it's recognized very, very widely. I'm going to zero in on the retirement savings, the private pension part of this picture. And in 10 minutes, I'm not going to try to turn to private health care issues. I think Len just summarized things beautifully with respect to Medicare, and also touching on the fundamental health cost and coverage issues in our system. So let me just say that in the wake of the election and in light of our financial crisis, I would suggest that retirement policy, apart from Social Security, needs to move in three basic directions. First, we need to do whatever we can to prop up our defined benefit pension system. I mean, these are, of course, the private sector's extension of a Social Security-like benefit, not as good as the mother of all defined benefit plans, the Social Security system itself, but plans that at least mimic, in a way, many of the cardinal virtues of Social Security. We need to do what we can to prop these up. They're suffering from various long-term fundamental secular trends that run against them. But one thing that we can do and we need to do in the short term is to give employers relief from the funding obligations, which are now about to be so dramatically and suddenly increased due to the drop in asset values during this market crisis. And I think Congress is likely to do that as part of the stimulus package. Number two, with respect to 401k plans, I would suggest we do not need to replace the 401k or to give up on the 401k, but rather to reform the 401k, or more properly to continue reforming and accelerate the pace of reform of the 401k plan. The K plan was originally established as a supplement to the traditional pension, the defined benefit pension, but done in a way that really did not reflect the kinds of values that Karen so beautifully articulated today and in the platform. The collective risk sharing, the being there for each other in time of need, the spreading of resources, progressivity. The 401k originally was a sort of every person for themselves kind of arrangement to an excessive degree. It has a non-discrimination regime, so the wealth has to be shared somewhat. But this did not go far enough, and people were left in a very laissez-faire structure. You decide whether to participate, you decide how to invest, you're on your own, good luck. We're transforming that, have been transforming that, so that people are almost universally covered in workforces that have a 401k. You're automatically enrolled in the plan unless you opt out. The investments are professionally managed up to a point. You're given a default investment that reflects professional expert input. And ultimately, the payouts of these plans can likewise be made more intelligent. Defaults can be used in a sensible manner to orient people to annuities, to lifetime income, whether it's commercial annuity or a different kind, but an income that actually gives people security in retirement rather than leaves them with the almost intractable problem of determining how to manage a pile of dollars over an uncertain life expectancy. The reforms of the 401k that have been taking place now have been sweeping the market. This automatic enrollment, automatic increases or step-ups in the level of employee contributions, automatic investment, that is, people being placed in a default investment that makes sense for most people and given the choice to opt out if they want, and hopefully some kind of automatic annuitization or a greater role for lifetime income in 401ks, together with an intelligent use of defaults to stem leakage as well. That is, to encourage people to keep the money rolling over or retained in their plan when they change jobs or lose a job, so that the savings are there for the long term rather than getting consumed prematurely. The other fundamental way we can reform both the 401ks and our IRAs, the stalwart pillars of our retirement savings system as opposed to our traditional pension system, is to do what the President-elect had proposed during the campaign, which is to reform our tax treatment. The deduction is the way we reward people for saving now. Tax deductions don't work progressively. The higher your bracket, the more you get. The lower your tax bracket, the less you get. A very backward policy. By replacing that with a credit, as we've begun to do through the so-called Savers Credit, which gives people a financial incentive that's not proportional to how high their income is, but it's proportional to how much they save, which is obviously the behavior we're trying to incent. By doing that, we can make the system more effective and more equitable. More effective because by encouraging saving by people who are not high income, who are not very affluent, we tend to promote actual new saving. That is, people aren't just shifting money from a taxable mutual fund, let's say, into a tax-free account, money that they already had saved or that they would save anyway. Those among us who are affluent tend to do that. Moderate, lower income people don't have those savings to begin with. Give them a better financial incentive. They're more likely to actually do incremental new saving. The expansion of this Savers Credit to make it refundable so that people without an income tax liability will get it, to deposit it into the accounts like a 401k or an IRA to make sure that the amount is actually saved to the extent we can, is something that the President-elect proposed during the campaign and that has a lot of support, albeit is costly. The third thing we need to do is to pursue universal coverage in pensions and retirement savings. Obama's proposed an automatic IRA to do that. This is an approach that has been developed by two of us. My co-author is David John at the Heritage Foundation, a senior fellow there, who's come together with me to develop this universal coverage proposal, essentially extending something like the 401k to the half of the U.S. working population that has no retirement savings vehicle at work, no convenient way to save. We would automatically enroll people in IRAs the way we automatically enroll people increasingly in 401ks, and have employers that are not willing to sponsor any kind of plan, a 401k, a defined benefit, anything else, have them at least offer their payroll system as an effective mechanism for helping employees save conveniently and automatically in the workplace. Interestingly, Senator McCain, during the campaign, endorsed this proposal as well. It's gotten wide bipartisan support and has been supported by a number of the key players in the top-tier economic team that the President-elect has already nominated and appointed. The states are also active in trying to do something to promote broader coverage here in a manner slightly analogous to the healthcare area, where the states are coming up with their own creative ideas. It's much more incipient in the pension area. The states are just beginning to think about it, but those of us who've been involved in trying to get the states to move on a track parallel to the federal government are encouraged by the amount of interest that we see among key people in the state legislatures, in the state executive branches who administer pensions and 529s, and among stakeholders. I think all four of us are looking forward to discussing and to Q&A. Michael?
Yeah, thanks, Mark. And actually, on that very last point on the state-based universal voluntary retirement funds, thank Mark has worked actually very closely with New America's California program to initiate and promote that. It almost got through the California legislature into law this year with CalPERS administering the accounts, and we're going to be revisiting that, of course. So I'd like to open it up. This was quite a broad canvas that was painted here, a number of different angles from Medicare to the to also the needs of the current workforce. So if you'd like to ask a question or make a comment, please, we ask you to please identify yourself in that process, and we'll take it. Yes, sir.
Do we have a mic?
Do we have a handheld mic, or?
Apparently not. Oh, good man.
Oh, yeah, there we go. Thank you.
I'm Victor Basso, consultant in national security policy. And this is a comment about Medicare. About 3 years ago, I published an article on Medicare pointing out that in 2080, the cost of Medicare would be per year $17 trillion. 12 of these 17 trillion would be deficit. Now the figures I'm giving you are up-to-date figures, not from my article 3 years older. They're slightly different. Now what I proposed is to have to solve this problem, or help to solve this problem, but by rather unorthodox means, by postponing human longevity. And by a gerontologist that I talked to, and this is again up-to-date information, say that if they receive adequate money, within 10 years, they can postpone human longevity or the aging process by up to 20 years, free of aging-related diseases. And this is the critical consideration. It's free of aging-related diseases. The problem is that after the 20 years expire, the diseases will come back. So it's a temporary solution which gives us 20 years of reprieve, at least 20 years, possibly 30 years of reprieve. But after that, but at least maybe science will come with another solution. Maybe we'll have a more prudent policy. But this is definitely a consideration.
Yeah, that baby boom, you can't get rid of them.
Did they tell you how much it would cost?
Yes, between 10 to 20 billion dollars for 10 years.
Okay. Well, let me just say, maybe we should work on that. But I would honestly say that 2080, it reminds me of a joke an actuary at CMS, where they run Medicare and Medicaid, used to tell. You look out, the projections of economic growth being slower than healthcare cost growth, and this was back in the 80s when people were worried about employment back then too. He said, the good news is, you look out 80 years, we're all going to have a job. The bad news is we're all going to be carrying a bedpan. And so it is true that it does look like it's going to claim the entire output. I would submit to you, Herb Stein's wisdom is quite useful here. If something is unsustainable, it won't be. So it probably is true that 2080 looks awful. That's precisely why people have to pay attention. I would say it this way. We can afford Medicare tomorrow. We can't afford Medicare 30 years from now. And so I think we've got 20 years to fix it, but for a different reason than you're
Okay. Yes?
I'm Elliot Wicks, and this is a question for Len.
This you, though Elliot speaks loudly enough, but still.
30 years ago, I argued that we couldn't afford the rate of increase of healthcare costs that we're experiencing, and I said we have to come to the point where we'll make decisions not to provide some care that has very low benefits for the cost. Almost nothing has happened along those lines. I have two questions. Do we really know how to do that? And do we have the political will to do it?
Yes and no. I mean, I would say, yeah, we've learned what's happened in between. First of all, you were ahead of your time. But second, no question, we have learned a lot, and you know as much as I do about what we've learned. We know, I mean, look, the variation in treatment patterns and expenditures just in our nation alone is such that if we could get the whole country to practice medicine like they do in certain pockets, we could get that 30% back really fast. So we do know how. What we don't know how is to transform the larger part of the country that doesn't practice that way. And we haven't done a very good job at all, although our colleague Shannon Brown did a great job of helping in this regard. We haven't done a good job at all at convincing the American people that more is not better. We tend to think that, you know, when in doubt, do it. The providers often have incentives to encourage us to think this way, but it is true that, you know, when you have insurance systems that are set up to basically, for those who have good coverage, cover everything beyond a certain point, then there's no incentive not to do the marginal value added thing. And similarly, if the fee-for-service compensated clinician gets money for doing it and it's not thought to be harmful, then why not? So fundamentally, that's how you build in really bad incentives. I would say 30 years ago, Elliot, we were looking at maybe 7% of GDP, and today it's 17. So when you think about what really is driving, in my view, the conversation we're having right now, it's because when you were thinking about that way ahead of your time, it was a nuisance. And healthcare premiums for a family were about 7% of median family income, and today it's 17, just like GDP. So what's happened is it's become a much bigger nuisance, so that more and more people are finding it unaffordable. Second, it's true that employers, while in the long run, Lord knows, everybody gets their wages reduced from employer contributions. In the short run, it's kind of hard to do that in any given year. So what's happening is in an increasingly international economy, more and more employers feel vulnerable about an uncontrollable item that is a bigger nuisance than it used to be, and that is healthcare cost growth. So they feel like they got to have some relief. So you got middle class anxiety that's real and systemic. You got business anxiety, which is real and systemic. And, you know, I think it was Rahm Emanuel who said the other day, you don't want a good crisis to go to waste. I mean, fundamentally, let's be frank, 6 months ago, 150 billion was thought to be beyond the pale. 150 billion is lunch money now. So at the end of the day, you can talk about, well, but here's the real deal. Here's the real deal. Go back to that night when Bernanke and Paulson went to the Hill and explained to Pelosi and all the leaders, we're going to have a depression unless you do something now. You know, I call that the come to Jesus moment. Everybody had to think about this really hard. And what that did is it made us think about priorities. When you think about priorities, you've got to do what Maya said. You've got to think long-term about what you spend now. We're going to have to pay for it. Trust me. Maya won't let me forget. We're going to have to pay for it. But it's stupid not to think about fundamental restructuring. And you can't think about fundamentally restructuring our economy and ignore healthcare. So I submit, Elliot, we would have had a good chance at having a serious conversation without this economic thing. In a funny way, it's made it more likely that we're going to take it on because people realize we don't really have a choice.
Yeah, it's interesting. When 150 billion becomes lunch money, people are going to no, I know. The people are going to quickly stop using the old Everett Dirksen, a billion here and a billion there. At some point, it adds up to real money, right?
A trillion here and a trillion.
Yeah, right back there. I think we just have time for one or two more, but go ahead.
Yeah, I have two questions. One is, what do you think the long-term prospects are for the PBGC?
I know it was sort of stabilized. It was in really bad shape quite a while ago, and then it got stabilized. But it seems to, with the possibility of a number of more bankruptcies, what's going to happen to that? And second, is there any discussion of continuing to raise the age of retirement for full Social Security benefits? And if so, how do you deal with? I mean, I'm a professor. I don't mind teaching until I'm 72. It's not that bad. I just go to sleep while the students continue to talk. But other people have jobs that are quite a lot more onerous and difficult. And I'm wondering if there's any thought about how to sort of equalize that for people who have manual labor jobs, things like that. How do you make that more equitable? Retirement.
Okay, I'll talk to about retirement age and then talk a bit about pensions. You know, I think all the options to actually deal with this are pretty unpleasant. When you start going through the details of which taxes do you want to raise, which benefits do you want to cut, nobody wants to do anything. So you sort of go through the unfortunate political cycle where everybody takes everything off the table, and many people have taken raising the retirement age off the table. But I think it will quickly come back on because it's actually so much more appealing than many of the other possibilities. One, it absolutely makes sense. We're living longer. We can't possibly be expected to be supported by other generations for many, many more years and even decades in retirement. And it fits with part of where the problem is coming from. I also think it has the benefit. We saw that when the retirement age was increased in 1983, when we reformed Social Security, they passed a bill at the time that increased the retirement age in the future. And you can do that again. So being able to hide from voters what exactly you're doing has a political benefit to it. I know it didn't work for me because when my father was about to retire at 65, he realized he didn't get to retire until he was 65 and 4 months, and like calls me yelling because it's my fault because I do Social Security reform, so somehow this must be my problem. But I still think the advantage of being able to pass something now that gradually faces in a change down the road makes a whole lot of sense. I also think the point you bring up, it's a well understood one, but certain people can work a lot longer very easily. Other people who are particularly doing manual labor or get disabled for other reasons certainly can't. And it just goes and reveals one of the broken social insurance programs that we have. Our disability program in this country doesn't make sense in so many ways. So disability will be what has to kick in to compensate for the growing retirement age, and we need to reform disability insurance so that it's more sensible and works with the problems we have now.
Let me just add that I think that what happens with the PBGC is going to depend very largely on what happens with our economy in the next few months, in the next couple of years. And because we've seen so much turmoil, we've got the big three now on the brink. These are the kinds of things that are going to determine the fate of the PBGC. But let's remember that the PBGC ultimately is not what it's about. As you know, it's an intermediary. Ultimately, it's whether the workers are going to get the benefits that have been promised to them and whether the taxpayers will ultimately have to step up in order to ensure that or not over the long term. I would note that we have raised the retirement age in the private sector. I think we did it a few weeks ago. Many of us may not have noticed that, but unfortunately, de facto, the American dream of early retirement is really largely gone. I say that not because I don't think the market will recover. You know, I'm hopeful, as most of us are, that the markets will recover sooner or later, but that was always a bit of a hollow dream. It's something that the advertisers dangled in front of us during breaks in the Super Bowl, and not something I think that comes from the fundamental values or traditions of our society. So the idea that you can sort of kick your shoes off and walk down the beach, starting in your late 50s or early 60s and play golf for the rest of your life is something that is only available to a few of us and always was only available to a few of us. But I think the expectation of being able to do that, especially when many people don't like their work, don't like their boss, don't like their situation, the ability to look forward to that and the illusion that will be possible, at a relatively early age, is one that I think has been unfortunate for many years, and now it's just become more obvious.
Yeah, this lady back here, we can have one last quick question.
My name is Cynthia Samuels, and my question is partly based on somebody's remark about you can't get rid of the baby boom. What is your research showing you about? I work with bloggers, and they're all 2 billion years younger than I am. You should hear them. What do you see in your research about the potential for everything you're talking about affecting, when we talk about social togetherness, how the generations are going to relate to each other as these choices become apparent? Has any of you done any looking at that side of it?
Sounds like it's time for David Gray to come up.
No, I'm curious what you hear from your bloggers.
Well, they're very, they don't have any faith in, you've heard it all, they don't have any faith in Social Security. They think that my generation has made a mess and is selfish, and there's just a lot of what you would expect, but more of it than you might think.
Well, if they save more from the things Social Security's going away, that's probably a good thing. So
But unfortunately, I think this may be something, Len, like, the entitlement word that you started talking about. That myth that you should assume Social Security will not be there has caught on with such dramatic success among, it seems, everybody under a certain age. And they seem to repeat it, robot-like, because they've heard other surveys where their cohorts repeated robot-like. So, a whole set of generations has been brainwashed to assume that Social Security will not be there for them. I don't think that most of us who work in this area assume that Social Security will not be there. We're worried about the lack of sustainability of Medicare in particular. We're worried about making sure that things are solvent, that we're fiscally responsible. And that may, of course, involve all kinds of changes. But that's a far cry from not being there when you retire.
Well, the other part of it is that it's such a high tax compared to their income taxes for most of them. The Social Security tax is way higher, and so that's part of it.
I've actually always been struck about it in the opposite way. I've always thought that younger generations kind of take this sitting down. And it's sort of very impolite to suggest that there should be generational war. That's the wrong thing. Let's resolve this without generational war. But I'm always sort of stunned that many 20-year-olds think both that Social Security won't be there for them, what's been promised to them won't be there, something will be there, the truth, that's what the truth is. But that they think it won't be there, and yet they still pay a 12.4% tax without very much protest. To me, that's actually an incredible amount of, okay, we're letting the baby boom have this one. And I think that the baby boom has done well by themselves, and I think they will continue to. I think that it is a very powerful political generation. I think that we will see things like the expansion of prescription drugs without figuring out how to pay for it before we see more investment in pre-K. So it's not considered polite to pit generations against each other, but there are no win-win-wins when it comes to spending $1. The other day I was at a conference where somebody was talking about economic mobility and how it was so critical that we increase mobility for all the quintiles. That can't happen. When one goes up, someone else comes down. And unfortunately, the same is going to be true when we figure out how to divide resources. Now, we can do it smartly, and we can try to find ways to make investments that grow the economy, and we can try to grow the macroeconomy as much as possible. But still, it looks to me as though older workers have done much better from many of these programs, and the next generation will. And I've always thought that younger people could take that rather politely.
All right. So with that, I'd like to turn it back over to David Gray for the next panel concerning workforce.
Thank you very much, Michael, and yeah, everyone take a big stretch here as we switch panels. I'd like to welcome Katie Corrigan and Ray Uhalde and Phil Longman up to the panel here. Michael did a good job of balancing. We've got a lot going on today and keeping us on time, and I'm grateful for that, and we're going to continue to make that our goal for this and for our healthcare panel as well. In my capacity in directing our Workforce and Family program, I'm pleased to introduce our workforce panel to you. I won't go into the backgrounds and detail of all of our speakers because they're listed in your packet. But just briefly, Ray Uhalde is director of the Workforce Development Strategies Group at the National Center on Education and the Economy. Comes to us with significant experience at the U.S. Department of Labor and generally on employment and training policy. Katie Corrigan is the co-director of Workplace Flexibility 2010, where she helps oversee the strategy, legislative lawyering, policy research, media, and constituent outreach of that important effort. Katie's served on Capitol Hill, at their law clinic at Georgetown, and at the ACLU. And Philip Longman is the Schwartz Senior Fellow at the New America Foundation and Research Director for our Next Social Contract Initiative, and is the author of numerous articles in his latest paper on the principles of a family social contract, which I was honored to help co-author with him, is available in your packet. So as one of the themes we've talked about today about some of the opportunity to transform some of our policies as a result of this social crisis. The crisis makes it harder for us to afford certain things. It also provides an opportunity for a transformative change in policy moment. And nowhere is this perhaps more evident than in the workforce and how we do our work. And that's what we're going to talk about today. I think from a workforce standpoint, the idea of workplace training is something that has been unfortunately ignored both fiscally in terms of investments over the last generation. And while education's gotten a lot of focus the last 8 years, workforce training has not gotten as much focus. And now as we look, as Obama talks about 2.5 million jobs created by beginning of 2011, a stimulus package and an infrastructure training program that will help put people back to work. It's an opportunity to think differently about workforce development. It's also an opportunity for us to think differently about how we do our work, how flexibility might enhance, lessen the anxiety of families and workers, but also help us all to do work in a different way that is better for both employers and employees. And I think if we have an opportunity to think about ways which we can have policies that can get us the most bang for the buck and solve the most problems in one fell swoop, I think Phil may share an idea with us with his creative mind that helps us move in that direction. So with that, I want to welcome you to our workforce panel and invite Ray Uhalde to join me here and come up and present some of his thoughts on the American workforce. Ray?
Thank you, David. I'm glad to be here with the New America Foundation. With regard to these times, I guess in talking about social insurance programs, you'd have to start in the workforce area with the unemployment insurance system and unemployment insurance reforms. The stimulus is going to extend unemployment insurance benefits, but we need to go beyond that. The unemployment insurance system's not up to the task. It has too many holes, and it's not well connected to helping workers continue their education and training. Fewer than 40% of unemployed people receive unemployment benefits. Yet unemployment insurance is not only an important part of the social safety net, it's a critical economic stabilizer, returning about $2.40 to the economy in its multiplier effects versus every dollar of benefits spent. And the fewer people that actually receive benefits, the less stabilization you get during a downturn like we have now. Representative McDermott and Senator Kennedy have introduced what are referred to as unemployment modernization proposals. They'd make numerous reforms on unemployment insurance. They would cover part-time workers. Most states, if you're a part-time worker and you're unemployed and you want to get a part-time job, you're not able to draw unemployment benefits. They insist that you take full-time employment. Yet a growing percentage of the labor force is in part-time work. Low-wage workers have a particular difficulty, actually. While 97% of workers are covered by unemployment insurance, many workers don't actually receive the benefits. Low-wage workers oftentimes don't have the near-term wages accessible in the databases to determine automatic eligibility. That needs to be fixed. And lastly, in the vast majority of states, if you want to get some upskilling and occupational learning in this country while you're unemployed, only a few states allow you to do that beyond 26 weeks, and we insist that people get certificates and more rigorous occupational training. It takes longer than that period of time, so we need to tie unemployment insurance to getting longer-term occupational training. When we look to the workers being laid off, trade adjustment assistance has been a relatively small program tied narrowly to impacts, people losing their jobs because of trade and imports. This program, too, needs to be reformed and expanded, and I would expand it and sort of disconnect it from trade over time, although that won't happen in the near term, make it a worker adjustment assistance program as part of a comprehensive dislocated worker and worker adjustment system. You could conceive of unemployment insurance reforms, trade adjustment assistance reforms proceeding apace so that workers are covered with both income support and for training regardless of the reason of their layoff. We spend an incredible amount of inefficient time trying to attribute the cause of somebody's layoff to whether it was trade related or not. This makes very little sense to the workers themselves. Dislocated workers should be addressed like that, and you could vary the length of training and the length of income support based on something like tenure and age for workers so that you could adjust and maybe we would phase in over time and start with longer tenured workers getting longer term training and reduce the wages as resources became available. And you could support these training by something like the Federal Unemployment Tax Act, surtax that's been a temporary surtax since 1978, and it generates about $2 billion. It's constantly renewed for budget deficit purposes, but in fact ought to be deployed for a purpose like this. The stimulus that's going to happen is probably going to increase some funding for current programs, probably $300 or $400 million for dislocated worker training, $200 or $300 million for youth employment activities, and some reemployment money, $100 million or so for reemployment services for our one-stop career centers where people, it's sort of the emergency room for unemployment and unemployed people. I'd particularly point out in the near term the issue with youth employment. Andy Summon Northeastern University emphasizes the youth employment rate this past summer before the financial crisis hit. Only 32% of teens were able to get work during the summertime. This is the lowest employment rate the teens have been able to have, 1/3 below the employment rates in 1989, the largest decline of any demographic group since World War II. And there's plenty of evidence that if youth don't get work experience at a young age, it affects long-term career progression and the like. The infrastructure component of the economic stimulus will happen. There's discussions on the Hill about having an authorization for maybe a 1%, 1.5% carve-out, authorizing voluntarily to governors that they could direct some portion of that for support of getting workers to jobs, making referrals, kind of the bridge training that is needed to move workers from residential construction to commercial and industrial and public works construction, and some job readiness training and pre-apprenticeship training that could go on with referrals and placements and skill assessments being done through these one-stop career centers. Which brings me to the apprenticeship system, which the United States has about 400,000 apprentices around the country. This is a system that is talking about demand-driven systems. It's the most demand-driven training system that we have. It's got career ladders embedded in it. It's virtually totally private sector funded, but it's small in terms of the scale, but terribly important for the kinds of skilled workers that we're going to need for an ongoing infrastructure repair and building project over the next decade or more. And we're going to run into skill bottlenecks very quickly if we don't expand something like apprenticeship, both with pre-apprenticeship programs, which probably ought to be funded, at some significant scale, but also to expand the joint agreements, marketing that'd be a relatively low cost. And then we ought to consider subsidizing, putting some federal money into supporting the related instruction, that is the classroom instruction that goes along with apprenticeships that are a combination of classroom and work-based work experience and work-based learning. And Bob Lerman at the Urban Institute and others doing a lot of thinking in this area. Lastly, I'd just say then we have a public workforce system. Calling it a system is generous, I think. We need to look at a next generation of that's truly comprehensive, that tries to tie together a continuum between adult education, career and technical education, post-secondary level, and the employment services and workforce investment programs. There's a employment and training program buried in the food stamp program. There's a sizable employment and training program as part of TANF, our welfare program. These things are all not aligned, and none of them are really systematically aligned with economic development. So where I come from at the National Center, we've recommended building something called regional authorities that would tie economic development, workforce development, career and technical education, and adult education into a continuum at a regional level for regional authorities. And we think that we could actually incent that with a large incentive pool of funds that tried to transform the existing agglomeration of programs we have now. So thank you very much.
Ray's comments made me think of there's so many questions in my mind, and all three of these speakers are folks which you could spend an afternoon just picking their brain on a variety of subjects. I'm going to ask each one to talk for only 10 minutes so that we can have as much time for your questions as possible. So it's my pleasure now to welcome a good friend of the New America Foundation, Katie Corrigan. Katie.
Thanks again, David, for having me here. So when David invited me to come and speak on the workforce panel, one thing that I really appreciate about New America is they always include so-called work and family issues as part of this broader workforce agenda. And quite frankly, that's not always the case. So I always appreciate the opportunity to speak to an audience that I don't actually always see, although some familiar faces there. So the way I see it was the question on the table is basically, is the issue of workplace flexibility, which we define to include flexible scheduling, time off issues, and career maintenance and reentry, essentially still relevant given all of these big picture questions that are out there right now. I read an article, obviously we're not the only people talking about this, and I recently read an article on kind of work and family and specifically paid time off in the context of the recession. And not surprisingly, the kind of, two competing arguments in the article, one came from a free market think tanker who said, a recession is certainly not the time to raise the cost of work. And of course then the rebuttal from a work-family advocate, bad economic times are the worst times to lose a job because your child is sick and you don't have access to paid sick days, or your father has a stroke and you don't have paid time off. So those are the two competing arguments now in the context of a recession. I can tell you, after working on this issue for a number of years, those have been the two competing arguments, I think, since the beginning of the conversation on these issues. So it's the same conundrum, essentially, before December 2007 as we're facing right now. So what I want to offer you today is not so much getting into the weeds on these issues, but rather a new way of thinking about these issues. And I think given this opportunity where people are thinking about the new generation, the next generation, the new economy, now is exactly the time to think about how to build in these workplace flexibility issues up front rather than try and retrofit them in after this train has moved along the tracks. So one thing is, my organization, Workplace Flexibility 2010, we're a policy initiative at Georgetown Law School. One thing we've tried to do is get beyond, again, those sort of two basic arguments and really dig in and figure out, okay, what is the problem here? What is the problem we're trying to diagnose? And we are part of a broader initiative funded by the Alfred P. Sloan Foundation, of which David Gray is a part, that includes lots of academics, lots of projects looking at business practice, and we have been looking more at the role of public policy. And one thing we've tried to do is, and essentially to get beyond those two competing arguments, is to actually talk to a whole bunch of people. We haven't had any positions on any legislation or bills. We've been maintaining a form of discipline neutrality so that we have been able to invite in these competing views to try and figure out, okay, can we kind of get beyond that initial premise and think about what's the real problem and what might be some possible solutions. So what is the problem? I have lots and lots of research that can tell you there's a basic mismatch between the structure of the workplace and the needs of the modern workforce. Whenever I tell people that Sloan had funded $60 million of academic research cross-disciplinary on this issue, people kind of look at me on the Hill at least like, yeah, no duh. But the problem is, and the reason why I think they funded this research is, sometimes when you state the most obvious, no one's really been taking it seriously. So that's an obvious statement, and Phyllis Moen, who was one of the initial researchers, first at Cornell and now at University of Minnesota, articulated in her book, The Career Mystique, the reality of the workforce is no longer, as we all know in this room, that you either graduate from high school or in college, go into the workforce, and then retire in that sort of cliff retirement. Instead, it's an undulating line. And that's true for women and men. The reality is, at different points in time, we may or may not get sick. We may have caregiving responsibilities. We may lose a job. We may decide to take off to take care of small children. There's lots of reasons for that undulating line. But the reality is that the structure of the workplace in terms of how time is parsed out, how time off needs are dealt with, and certainly the types of training that you might need to re-enter the workforce, the public policy simply hasn't mapped that reality. And again, this is nothing new and different. I was reading a transcript of a hearing that Bella Abzug held in the early 70s that identified these exact same issues. She was somewhat projecting out, but I think she was projecting out to now. And a lot of what she was talking about has become true. So when we think about this workforce, and I just want to articulate it clearly, we're talking about young people who may, especially in the time of a recession, need to be working and getting training or education. So they're ramping into the workforce earlier. People are starting careers and having kids later in life. The question is, how can they dial down and then dial back up? For those folks who have a stay-at-home parent, I kind of think there's no such thing as a stay-at-home mom. At some point, everybody is in the workforce, either part-time, whether that's when they're younger or older. So how do you ramp back in? The sandwich generation obviously has been well documented. Flexible scheduling and time off needs, much more acute when you have both a parent you're caregiving for and a child. And the big shift, which I think our project has paid particular attention to, has been this issue of living longer. And certainly in the panel before, we just heard a whole lot about retirement security. So we're living longer, and retirement is going to look different. And certainly groups like AARP have been paying attention to this because their members are saying they're going to have to work, and they don't want to work in the way that they used to, which was kind of a full-time, full-schedule job. So we definitely kind of have the attention, I think, of some of the aging community. And the issue, though, is these are all big changes in the workforce, but public policy, there has not been a comprehensive, targeted strategy on how to deal with this. If anything, I think some of the solutions have been somewhat scattershot. And just as a sort of point of data, which I think shows that we need more progress in this area and that the lack of that strategy is a problem, there were some big gains on flexible scheduling in the 80s and early 90s. A big jump from 85, where you had 12.4% of folks on flexible schedules, all the way to a jump to 27.6% in 97. But in 2004, that number from 97 hadn't changed a bit. In fact, it went down just the slightest bit. So what's the problem? There's certainly more women, more caregiving, more aging going on. Why isn't this more acute? I have my theories. Certainly, in looking at this issue, I think one of the key sort of odd things about it is so obvious. We all deal with it. It's right there every day. Just this morning I left my 2 toddlers at home and figured out how to get out of the house in time and make it here and prepare these remarks. So we're all dealing with it in different ways. But interestingly, an anthropologist at UCLA did a study on this and showed that Americans have a lot of guilt in this area. Women and men, but particularly women. You make these decisions that are very personal about which job you take, about whether you leave work early to go home for dinner or not. And they feel very individual, and people take them on in a very individual way, that is my decision, my choice, and I'm going to pay the consequences in the form of feeling really guilty about it. Interestingly, they did this comparator with Italian families. Same pressures, same people working, dual learner couples, but not the same guilt. They view this very much as a community problem, something that wasn't just on their shoulders. Their church, their family, their community, their government was there to help deal with it for them. So again, I think that all that is to say is there's not one way to look at this. This can very much be viewed as something that's a social problem. And certainly, that's one of the things we spent a lot of time with David proving. We've done a series of hearings over the years, how flexibility relates to health and its impact on the stress. How does it relate to people with disabilities trying to maintain credibility in the workforce? How does it relate to children? How does it relate to families? I mean, there's lots and lots of connections, but it's sort of one of those issues that seeps out rather than being squarely in one place, which I think makes it hard to deal with as a policy problem. So again, that's something that we've spent a lot of time on in our project and had the luxury to do, which is really define this as a public policy field squarely. So if you go on our website, you'll see a whole lot of information on the data, on the law, and we've very much, I think, proven the fact that this is something that the society needs to deal with because there's so much spillover effect. But again, we're still not quite there. And then something like this economic crisis happens, and I think it kind of blows things open. I mean, there's a lot of big picture thinking going on in a lot of different areas. And I feel like we're actually poised at an interesting moment where we've now got this field, we have these sets of issues, we've made the linkages. And now what I would like to see as we move forward is to really kind of integrate. So integrate into these conversations on workforce development. When you think about career maintenance and reentry, we've now scoured the law. No one's really thinking about the stay-at-home caregivers who now might have to go back into the workforce because of the recession. Training programs don't squarely kind of address them and their needs, which is they've been out for a long time. How do you deal with that? They might have been an accountant in a past life, and now you don't want them to have to become the retail clerk. You want to maximize that knowledge. So, so just to sort of end it, 3 thoughts. In terms of these 3 different areas of flexibility, flexible work arrangements, lots and lots of businesses are doing it, and lots of them aren't. Some of it's pretty mundane why they're not. They don't know about it. Their managers don't understand it. They're a small business, they don't have the resources to kind of learn about it. So that's a very simple way government can do a lot of education of business itself. The time off issues are tricky. They can be very expensive. But one of the things I think we've surfaced in conversation is that certainly they may be big ticket, but also there may be some way to draw in business where one of the big ticket items is replacement costs. So if someone's out, dealing with a sick parent, who's filling in for them? Well, that's something government can think about. And then finally, like I've already mentioned on the career maintenance and reentry, this is just an open field. I feel like there's so much work to be done in thinking about, again, the fact that people may decide to take some years off, but because of different economic reasons, are going to have to ramp back in eventually. So how do you keep them relevant in this new economy? And just my last plug, as we talk about a new economy and green jobs and infrastructure grants and all of this stuff, flexibility plays a role in each one of those. So when you're in your silo, how do you deal with the reality that the workforce looks a whole lot different? And you're going to have this flexibility built in if you really want to maximize the value of that workforce. Thanks.
And then Phil Longman will be our next speaker. Please join me in welcoming Phil.
Well, thank you very much. I'm afraid my remarks might at first seem a little strange and eccentric and off point, but I will tie them together as best I can by observing just to start, that even before this current economic downturn, there were more American children who experienced their parents' bankruptcy than experienced their parents' divorce. So that the state of economy, the availability of good jobs, is very much to do with the state of the American family. Now, one of the things that's changed a lot in the last few months is there has come to be this tremendous new consensus that we need to be spending a whole bunch of money real fast on infrastructure. It looks like we're going to be moving Earth like it's 1959 again, with the Interstate Highway and the St. Lawrence Seaway and stuff. Except that if you listen to this conversation very much, you quickly realize that while everybody kind of agrees that infrastructure is good, when you scratch down a little bit, what do people mean by infrastructure? And almost inevitably, it's roads and bridges, roads and bridges, roads and bridges. And at the same time, we're going to be building all these roads and bridges. We're going to be reducing energy dependency and making the air cleaner and all that. So I want to use my time here to just briefly float an idea that will be in the next issue of the Washington Monthly when I get it written all down, for a sort of single policy lever that would, among other things, stimulate the economy, make driving faster and more fun, reduce the cost of highway repairs, prop up home prices, save thousands of lives, reduce greenhouse gases, dependence on dirty energy, and some other stuff I won't get into. And what is that? To give you the vision of this, I have to tell a little story about Interstate I-81, which is not too far from here. Some of you probably know it, have driven it. Basically starts in the border of Canada and comes down through Harrisburg, the Shenandoah Valley, and just winds up in Tennessee. And why this road is there, it's kind of hard to say because it doesn't really go anywhere. You know, it passes Scranton and Harrisburg and Roanoke, and yet if you go on this road, it's worth your life because every fourth vehicle on this road is a truck, a long-haul truck. It's got a higher percentage of trucks on it than any interstate in the country. It's also, through Virginia at least, a very hilly road. So you find yourself behind this truck, and then you pass it, and next thing you know, in your rearview mirror, here it comes down. And last November 21st, in an all-too-typical accident, 4-year-old Ivan Ryman and his 1-year-old sister Maggie and their 80-year-old grandmother were all killed, and many other people were injured when one of these trucks came down the hill, couldn't stop, and smashed into them. It's a dangerous place. Well, why are these trucks on this road? Well, mostly it's because I-95 is so congested and has tolls on it that truckers find it worth their while to drive all the way around, hundreds of extra miles, to destinations in the southeast to avoid I-95. So anyway, so Virginia's got to do something about this. First idea is, well, let's build more lanes. That's what highway departments do. But there's a problem with that. It would cost $11 billion to add 2 more lanes to this highway just in Virginia alone. And Virginia doesn't have that kind of money. So they said, well, we'll have to put tolls on this road. And we'll have to charge something like 17 cents a mile for people to drive on in an automobile. And when that idea got floated, you know, anybody's anywhere near the Shenandoah Valley heard a huge explosion. That's not going to happen, right? Then some folks in Virginia had a smarter idea. Turns out that parallel to I-81, all the way through the Shenandoah Valley and up to Harrisburg, is a line of what was once the Norfolk Southern Railroad, is now the Norfolk Western Railroad. Now, the railroads, as you might know, are actually gaining back a lot of business from trucks these days, mostly to do with the price of energy and price of labor and this congestion problem. And that line's got more traffic on it. But the railroad can't really get any more traffic because It's only a single line. It was neglected in the 70s. They have hardly any signaling. So they're basically at capacity. And at the same time, you know, they've been going to Wall Street for a long time, sort of making the case that, hey, look, our business is up, but we need more money for infrastructure. But Wall Street, you know, they had a better idea. They said, oh, no, we're going to take the world's savings and put that into subprime and credit cards, right? And of course, now credit's not available at any cost. So, people of Virginia have this choice. The railroad has decided that they would be more than happy to have public money that otherwise would be going to building these 2 lanes on I-81 put into upgrading double tracking and otherwise increasing the capacity of that line. In return for that, the public would gain public access to some of that capacity for purposes such as running commuter trains. And I ask you, you know, what is the better policy choice here? Trains get 11 times more fuel efficient per ton mile than trucks. They produce far less pollution. Now that we live in a world of freight logistics where most stuff is put in containers, and those containers can be just lifted from truck to train to boat, it's quite easy to integrate these different modes. But of course, talk about silos. These kind of proposals bridge many, and there's not many folks that put the dots together. That's an example of one project. Throughout this country, there are choke points that enormously disadvantage rail and increase the cost of shipping and ultimately goods for all of us. Some of it's amazingly pedestrian. The Howard Street Tunnel in downtown Baltimore. Some of you might remember a few years ago it caught on fire. They had to cancel 3 Orioles games. When that happened, because of that choke point, they had to divert trains as far west as Cincinnati that were on their way to Florida from the Northeast. That's just the way the network works. The tunnel is too small to put double-stack trains through. It needs to be widened and deepened. Because of that disadvantage, the Port of Baltimore is really hurting. And the whole economy of Baltimore is hurting because you want to ship anything south, it's got to go through that tunnel. Fix that tunnel. In Chicago, which is the rail hub of America, it takes a container 48 hours to go from New York to Chicago. But because of the way the tracks don't meet up, it has to be unloaded, put on a truck, hauled across town, put on another train. They call it rubber wheeling. Right? It's an enormous environmental disaster. It causes all traffic congestion. It would cost $1.5 billion to fix. Congress gave them $100 million. At the same time, they were authorizing the bridge to nowhere. Okay? We don't do infrastructure very smart, but there are ways to do it. I just want to leave you with one vision, and I call this the steel wheel interstate. And the missing component here is electrification. Electric locomotives are really a remarkable thing. They're the only form of transportation that doesn't carry around its own fuel source, not even a battery, right? Which means that the physics of the thing are such that it accelerates much more fastly, it can go faster and use less energy than any other form of land transportation. More beautiful than that is you can power it any way you like. Think about the windmill debate. What's the wisdom about wind power? That the big problem with wind power is the wind isn't where the people are, right? That you have to build these tremendous high tension lines across the country to get from Texas to Los Angeles, for example. But what if you put the windmills next to the newly electrified steel wheel interstate system, right? Now you have the wind where you need it. You don't have any transmission loss. 100 years ago, a railroad called the Milwaukee Road used to run. It was the last transcontinental railroad built, and so they got the worst route. And they crossed the Continental Divide out in Montana, creating the Grand Tetons. No steam engine in the day could possibly handle this grade. So they electrified the line, one of the few to do so in this country. And what they found out is not only could these electric trains get over the hill, they could use the abundant hydropower that's in the region, totally clean energy, right? And because of a special feature of electric locomotives, when they brake, they go from consuming energy to creating energy, right? It's called regenerative braking. So as one train is struggling to get up over the Continental Divide, another train braking down the other side is giving it power. How beautiful is that? That's a 100-year-old idea, and I bring it to you again. Steel Wheel Interstate. Thank you.
The last Rolling Stone concert I think I saw was at the Steel Wheels Tour, and we're going to send Phil Longman on the Steel Wheels Tour to promote this idea, hopefully stopping at 1600 Pennsylvania as the first stop. I really appreciate all three panelists providing thoughts on the social insurance program and the broader workforce piece, how we all might work differently and how flexibility could be a component of the structure, and then a specific idea that it could create a lot of jobs and be good for a lot of folks. We have about 15 minutes left. I'm going to take some questions here. But I'm first going to start. Do we have questions from the press? Are press folks still here who have specific questions? Yes, sir.
Sure. Brian Hess with the Employment Trading Reporter. Question for Ray Halding. What areas do you think the new administration, especially within ETA, would be most wise to put in its research, demonstration, and discretionary funding behind?
Well, they haven't asked me, but I think an important area is to how to better align the workforce, adult education, and economic development so that they're working in regional growth strategies. Too often they're pulling in different directions. They're not speaking with one another, and we've learned how to do transactions based on recognizing employer demand, but we haven't learned how to develop strategies that work on a regional demand and line up with those. So I think that needs to be done more. They've begun some of that, and I'd put more R&D into that because it's the regional economies and work in that area that's going to help grow state and the national economies.
Do you see any community college investment that will be significant in the next administration? We'll talk about community colleges for just a second and the role they might play.
Well, I would think so. I mean, they're a major force and provider in workforce development. I think I would invest some more in trying to link them much closer to our public workforce development system, the career and technical education that goes on in there, better certification of skills acquisition, better assessment of skills and knowledge, skills and abilities, and trying to get both the public workforce system and the community college system to develop these regional strategies.
Okay, thank you. Any other press questions?
Peggy Simpson with the Women's Media Center. Ray, I was interested to know if you agreed with Ms. Corrigan on this particular economic collapse being an opportunity possibly to move forward with some family workplace flexibility policies and integrate those into
Well, I think she described at the outset the major challenge that's always faced by workplace flexibility issues, and that is to the extent you're raising the cost of work, those will be used as objections to that. I think there are a lot of opportunities. For example, the unemployment insurance reforms I was talking about, part-time workers, which affect families tremendously. I mean, much of that part-time work is not involuntary, it's voluntary. Yet in the unemployment insurance system, we treat it as a second-class option, and to the extent that that was treated more favorably, that would help in these choices that people have to make, for example.
Katie, do you want to?
Yeah, just to add in, I think one thing that I thought was quite interesting that you were talking about is really connecting into community economic development. And certainly what we've seen, we've done a bunch of policy discussions around the country in different communities. And one reason why they've been successful is because lots of local communities are looking at ways to attract and retain workers in a particular locale. So for example, out in Arizona, there's been a lot of focus on the aging workforce and how can you keep those folks employed in a way, and use flexibility as one of the tools, including part-time and flexible schedules. So what I really liked out of your comments is, I think absolutely there is got to be better conversation between that local community development piece, both in the workforce training, but really I think across the board in lots of the block grant programs, and the connection to flexibility, both for the aging workforce and for those with other types of caregiving responsibilities.
Thanks, Katie. And finally, any other questions from the press? All right, sir, identify yourself.
I'm Arnold Packer. I have a two-part issue. One is I'm surprised in this discussion of family policy that nobody has mentioned the change in the welfare law that took place during the Clinton years with a work-first situation and a time limit on what was the safety net. And the second half of that is both in the Carter administration and I believe in the Clinton administration, that program was to have government be an employer of last resort for family heads with children. Much of the infrastructure jobs are more male-oriented than female-oriented. The social services are going to be decimated by the shortfall in state and local resources. You don't need blueprints and months of engineering. So why don't we just implement a situation where states can provide jobs on a counter-cyclical basis so it disappears subsequent to the recession or depression, and give out those jobs either to every family head with children who has no other income or as a priority. Family head. Why wouldn't that be a family and workforce and anti-recession policy that makes sense?
Yeah, in putting together this workforce panel, we also didn't want to lose the family component of the broader social insurance piece, so I appreciate your including it. Does anyone want to respond to Don's question?
I was just going to say on the work first push on TANF, that also influenced how states implemented the Workforce Investment Act subsequently, because it followed in the second year. But also the economy was very hot through that time, placing people in jobs. Now you're going to into a period through probably 2011. The labor market's going to be very slow and tight, and should be much more emphasis on building skills and talent development amongst both welfare recipients and others to try and build up their skills, not try and have them search around for jobs more immediately. On countercyclical jobs, I've heard no discussion on the Hill about public service employment. Arnie, I was around with you. I know enough of the black eyes that countercyclical and public service jobs got during that period of time. And obviously we could learn from it and try and prevent having half the Los Angeles police force or some other city's police force be on public service jobs and all of that shifting and substitution. But I haven't heard that. I've heard making more of the emphasis on trying to link these jobs to the investments, whether they're the smart infrastructure investments or the other green jobs and others, being private jobs hired by contractors.
Katie, did you want to add anything?
Yeah, just we we don't squarely address welfare policy, but certainly one thing we've really spent a lot of time looking at is I think workplace flexibility tends to have a brand of the white-collar professional. But when you really dig in, you can see even flexible scheduling has a lot to do with workforce attachment. And for those who are single parents of children or have other caregiving needs for grandchildren, there's again a kind of more acute need sometimes for scheduling that maps on to the child care situation. And also there's some different needs among the low-wage workforce around predictability. We think of flexibility as being ultimately flexible, but we also define it to include some predictable nature of your schedule. Otherwise, you can't deal with things like scheduling appropriate child care. So we've kind of absolutely looked at the population, I think, that is now out there in the workforce and dealing with having kids and juggling that job. So that's just one.
I just want to mention that Bob Lerman is having a session at the Urban Institute on this issue on the 16th. And you contact Bob and want to come, it's wonderful to do so.
Phil, did you want to add anything to that or anything more broadly on family policy that,
I can't get trains on.
All right. Stick with it, man. Go with the vision there.
But I'll hear some time.
Yeah, good.
When you take the train from Washington to New York, it's under Canton area, you might notice. It's wired. The wires there are the result of a New Deal program that put lots of people to work at Reconstruction Finance Corporation. Unfortunately, the New Deal ended before they completed the wires. Right? They got as far as New Haven, and but this is a kind of work that is semi-skilled, right? To build the generator, that's tough. It takes engineering, it takes time. But you can put people out there in gangs, putting those the poles in and stringing the wire, even if you don't yet know how you're going to generate it. And I think just in the spirit of the New Deal, where we had programs like the CCC that left us with enduring infrastructure, and the Reconstruction Finance Corporation that electrified the old Pennsylvania Railroad, we can create an industrial army and put them to work.
Do you think that the bailout of General Motors is best spent helping them build cars, or might there be a role for General Motors in this
General Motors, until they sold the division a couple of years ago, was the leading maker of diesel electric locomotives in the United States. And they specifically built engines that could run both under wire, on a third rail, or as just standalone pieces. So they know how to do that. And if they've forgotten, they can ask General Electric, which is the world leader in building these things, and has a huge plant near Pennsylvania that could use some work.
Very good. Very good. Further questions? Yes.
My name is Sally Shake, and I just had a thought. We have new GI Bill benefits for Iraq, Afghanistan war veterans. Those benefits were passed, I think, with authorization of about $62 billion over a period of time. The benefits go into effect on August the 1st of 2009. A lot of the veterans are just now learning about it. There's a provision that allows spouses and dependents to receive the benefits transferable to them if the veteran doesn't use it. So you're going to have a whole cohort of veterans who are going to be going to college beginning in August, September, October, and thereafter. So it seems like you've got a cohort for study and for intervention relative to family policies. If they have families now, they've already been through some kind of family dysfunction or necessity to adjust because of deployment in the past. So they have a concept of variety of family structures and ways of approaching problems. And in terms of the labor market, these are people who have been trained, whatever training they received in the military, and now they're going to be looking for more career-oriented opportunities. So to the extent that they receive information and guidance relative to green jobs, whatever that may mean, or participating in infrastructure, whatever that means, or these opportunities, there's a cohort that, to use the current aphorism, they're fired up and ready to go.
Yeah, appreciate it. Before we answer this question, I think let's take one more question over here, and there's a hand I saw over here.
I'm a visitor from Arizona.
Right.
I'm very pleased to have a briefing, a real watching a briefing. I had a question. Over the last, show my name, Sheila Tobias. I work in education, science, and mathematics. Over the last 30 years, we've made tremendous progress in anti-discrimination and employment. I wondered if you, Corrigan, are thinking about structurally protecting that achievement in a period in which there were many, many layoffs, and remembering what happened in the 30s, when even a very favorably inclined government allowed married women to be selectively dismissed when there were two incomes coming in.
I appreciate it. So we have two questions here. Anybody want to jump out here before Katie answers and talk? Do you have any thoughts? I just, either in reference to either of the two questions, or if not, just as a point of a wrap up. Before Katie takes us out. Katie, do you want to jump in on either one?
Yeah, I mean, I'll just be quick on this. In our project, we have really taken a pretty deliberate approach of not using the non-discrimination model of trying to focus in on one group of people, whether that's women or caregivers. And instead, we have really emphasized more of a kind of neutral sort of shift that would create flexibility as being normative. So regardless of the reason why you might need that flexibility, we think that especially in flexible scheduling, whether it's because you're an older person and want to have time with your grandkids, or whether it's because you have, a sick child, or whether it's because you want to go bungee jumping, which a lot of the data shows kind of the Gen Yers do, that we really have tried, especially in flexible scheduling, to try to approach this in a very neutral way. Because quite frankly, what we really heard from business is once you start dividing out some of the reasons, it can get tricky. So it's not a full answer to your question, but that's the approach we've generally taken from our project.
I just mentioned with regard to veterans, we have a relatively small veterans employment training service that a principal function is twofold. One is to ensure that veterans, when they've been called up and leave a job, go to service and come back, that their job rights are retained. But secondly, they have this small program to be able to certify the skills of returning veterans, essentially translate their military occupational specialty into certifications for domestic occupations. But it's relatively small. There was, during the Clinton administration, we launched a fairly substantial set of projects in discharge centers around the country, Fort Bliss, Texas, and San Diego, for example, where large numbers of soldiers are being discharged, and trying to make a concerted effort to help place them and do the certification and place them within local communities, frankly, as an economic development strategy for these people. And if you could retain 30% of them before they dispersed around the country, you could help build up your economy locally, because they are young and very skilled, if you can translate that to domestic economy. But we don't do that very systematically.
Thanks, Rick. And Phil, any last word on this? Or anything?
On the discrimination point, one of the real challenges, and I think a lot of us have lived it and live in this knowledge economy, is it's actually very difficult to get yourself educated and established economically before your biological fertility or your partner's is begun to decline. In other words, it's very difficult to start a family for many people before they're in their mid-30s. It was an interesting case, the last case that the Supreme Court looked at on affirmative action was the University of Michigan Law School case, remember. Who was the plaintiff? It was a woman about 35 years old, white, who had, after graduating from an undergraduate degree, had decided to get married and start a family. She raised 2 children until they were about age 5. in kindergarten, and then she decided she wanted to pursue her education at University of Michigan Law School, and school turned her down. And I don't want to speak to the merits of that case, except that notice nobody in all the discussion of diversity and its value, and as an rationale for affirmative action, brought up the idea that maybe the diversity that would be achieved by having a woman of her profile and experience on campus would be something educationally useful. I think this is actually one of the biggest unaddressed discriminatory issues in our society. It affects women, it also affects men. And if we were at a minimum to try and raise consciousness enough so that universities and employers viewed that kind of diversity as something worth pursuing, I think we go a long way in achieving a lot of those flexibility goals that you're talking about too.
Very good, very good. Our panel is electric. I knew they would be, and they are. And I appreciate their taking their time to be with us today. And then I'd like to welcome my colleague Julie Barnes to the podium for our panel on healthcare. Folks come up over this way.
Oh, you got the tags? Good, he's got it. Hi. Yeah, I look for the next social contract. Thank you so much for being here today. We got one more panel, sir. Don't leave. Oh, I was talking to him.
Thank you so much for being here for the third and final panel of this program to discuss the possibilities of reforming our healthcare system in the midst of an economic crisis. They saved the best panel for last, so I'm glad you're here. You may have noticed that this panel has received several plugs throughout today's program, and it's because, as Karen Kornblue said earlier, that addressing our healthcare system crisis is arguably the most pressing social problem of our time. Again, I'm Julie Barnes, Deputy Director of the Health Policy Program. You heard from our director earlier, Len Nichols, in the Entitlement Program. And we in the Health Policy Program at the New America Foundation, like so many organizations and stakeholders and policymakers these days, are dedicated to developing solutions about how to create an economically sustainable healthcare system that does three things: covers all Americans, reduces healthcare growth, and enhances the quality of our healthcare delivery system. Those three, coverage, cost, and quality, are the three big ticket items that everybody is talking about these days. We know the next administration is serious about them. Certainly, Obama campaigned on the idea of reducing medical costs and improving quality and eventually achieving universal coverage for everyone. We know that Senators Kennedy and Baucus and other key policymakers are continuing to work on their already well-developed healthcare proposals, which is such a refreshing change from what we experienced last time we tried this in '93 and '94. Unions and businesses are coming together with one voice to say we need healthcare reform now. Just this week, the Insurance Association, no less, released its healthcare reform proposal, saying, among other things, that they're going to guarantee coverage regardless of pre-existing conditions so long as everyone is required to have health insurance. So we are truly in a new time of realization that this is in a crisis we need to fix, and it's even on Time magazine this week, just as further proof. So that is the only visual aid I have. So if it's obvious that we have a consensus that we have a crisis, I guess the next question is, can we afford to fix it in the midst of an economic crisis? And so the big story today, you may have noticed, is that our unemployment rate is at an all-time high for the last 15 years. More than 500,000 people lost their jobs in November, 1.2 million over the last 3 months. And that's bad enough, but if you think about what that means, since most people have their health insurance through their jobs, what are they going to do about their health care benefits? Some people will be lucky enough to go on their spouse's plan, but some people, probably a lot of people, will not. So what will they do? Will they buy Cobra? Cobra costs, on average, about $13,500 a year. And if you lost your job, are you going to be able to afford that? And so what do? You enroll in Medicaid? Do you choose to stay uninsured? and further burden our system with uncompensated health care costs. So this is an issue about which we can no longer wait. Today, our panelists, thank goodness, will help us understand these problems and hopefully propose how we might be able to go about affording them. So we'll begin with Joe Minerick, who is the Senior Vice President and Director of Research at the Committee for Economic Development. And Dr. Minerick leads the policy research projects on CED's agenda, including healthcare and the economy. Joe will be discussing the business case for reform, why the current economy is making it difficult for businesses to offer health insurance coverage. And frankly, I've seen his slide presentation, and it's just really depressing. So I'm hoping he will tell a couple of jokes or something. Jenny Kenny is a healthcare economist at the Urban Institute with more than 20 years of research experience on public healthcare programs. And she will discuss the effect of the economic crisis on Medicaid and S-CHIP, something certainly near and dear to the hearts of the states and their budgetary crisis. And last but not least is Elizabeth Carpenter, who will hopefully have the good things to say at the end of the program. She's our Associate Policy Director at the New America Foundation Health Policy Program. She will comment on the data that we just released on the economic cost of doing nothing on healthcare reform. So that will really explain why healthcare reform should be a priority in the midst of an economic crisis. So let's begin with Joe. I'm going to sit out here so I'm not in the way of your slides.
Well, I'm the skunk at the picnic who's going to show you charts. And Julie, if you thought that the charts were depressing, I should warn you that I woke up in the middle of the night last night thinking about another one, and it's actually the most depressing of the bunch. That's the bad news, and there is good news, and as soon as I think of it, I'll let you know. Let me talk about really basically 5 things. Number 1, what is the problem in the aggregate? Number 2, what is the problem for employers? Number 3, what is the problem for households? Number 4, what is the problem? And number 5, what is the problem with solving the problem? And I think that'll kind of give you the picture by the time we're done. For starters, what's the problem in the aggregate? Len mentioned this already, but the picture, there we go. The picture here shows what we call excess cost growth. That is, how much faster is the cost per beneficiary of healthcare consumers than the rate of growth of the GDP. So costs for beneficiaries are growing faster than the cost of the income out of which we produce the cost. And if you take that kind of excess cost growth and you extend it out over time, you get a picture where over a long period of time, and this chart has one observation for 1993 and then gets to the most recent years where data are available, and you see that health care is, the cost of providing health care is a growing share of our economy. If it continues to grow at current rates, at some point it's going to eat Cleveland and everything to the west of there. So that's the problem to the extent that we look at what our long-term budgetary situation is. Now, the point of the conversation here all day has been, where are we going after the economic crisis? And this was what I woke up in the middle of the night in a cold sweat thinking about. Suppose that by the time we're done by the end of 2009, and this is probably not an unreasonable number, we will have piled on an additional $1 trillion of public debt to cover the various and sundry bailouts, a stimulus program, and of course the additional deficit that we have because we have the effect of the crisis on the economy in the first place. And it just struck me, let's see what that does to the growth of the public debt going out for a few years. And on the basis of CBO's most recent numbers, with assumptions that are reasonable about what we do with policies such as the cost of the war and the expiration of tax cuts, if you put all that in the blender and add on the debt service costs of that additional $1 trillion of debt, essentially what happens is that the ratio of the debt to our economy that we would have had in 2018 we will have in 2012. So in other words, the long run has gotten 6 years shorter, 6 years closer, as a result of the likely cost of the financial crisis. Now, what that says is, if you believed that the growth of healthcare costs was running us into a wall as it accumulated additional debt that we could not manage and that would begin to become a serious economic problem, and if you believed that you had a certain amount of time to fix it, we just lost 6 years. George Allen, not the senator, the Redskins football coach, was famous at one point for saying, "The future is now." It's almost as though the future is yesterday. We've run out of a lot of time to deal with the healthcare problem before it deals with us. Now, what does this mean for employers? This is a slightly tricky chart, and the scales on the two sides are not identical, but you'll get an idea from this. The amount of money that corporations, this is corporations only, have been paying in health insurance premiums, and this goes back to 1960 and extends to as close to current as I could get, has grown by about 3% of the GDP. And of course, over that time, what has happened to profits is essentially they've been fluctuating up and down in a relatively narrow range. You'll note that over the last few years, corporate profits as a percentage of GDP were relatively high. As the data become available for the next few years, let me assure you that will go down. So corporations have been squeezed by the rising cost of healthcare. Healthcare is becoming more expensive, insurance is becoming more expensive, and businesses have had a hard time catching up. Len Nichols from New America has written persuasively that businesses, in fact, are caught on a treadmill that's really spinning faster than they can run when they try to pass along the cost of higher healthcare costs to their employees, and they're stuck in the short run paying for some of those costs. Now, where does that take you? Here's where we've been from 1999 through 2007, and the scales of the two axes of this chart are equal numbers of people from top to bottom. I made it this way to give you a sense of what's been happening. To put it in words, over the last 8 years, the U.S. population of working age and plus children, so in other words, under 65, has grown by just about 20 million people. Over that period of time, the number of people covered by employer-based health insurance has not increased at all. So in other words, what has happened over the last 20 years is the entire increment to our working age population and their dependents has not found coverage under employer-based health insurance. Some of those people have gone on public programs, some of them have become uninsured. But there's been no increase in employer-based coverage over those 8 years, even while the population has been growing. So that's been a problem for individuals of working age and their dependents. If you look at what has been happening to firms offering health benefits, this is the percentage who do offer, and you can see it's dropped by almost 1/7, from 69% to 60%. What has been happening largely is that as businesses of small and moderate size have been going out of business, businesses that offer health insurance have gone out of business. New businesses that have been created don't offer health insurance because they can't afford it. And as a result, health insurance is becoming less available to individuals, and that's part of the reason why you saw what was going on in the last chart. The percentage of Americans not covered by health insurance has been growing, and employees have been taking the hit in a number of ways. Contributions from employees and employers have been going up. Deductibles under health insurance policies given by employers have been increasing. Co-payments have been increased. These are all ways in which employers have tried to pass the cost along to their employees, to the employees' pain over time. And another phenomenon which I have not been able to represent quantitatively, but anecdotally it's becoming significant. Employers, to an increasing degree, have been telling their employees, okay, I'll give you a health insurance policy, but I'm not going to cover your wife and kids. And that has been one way of keeping the aggregate cost down. Okay, so what is the problem? In my remaining 30 seconds, let me try to explain one important phenomenon here, and this is something that I think many people probably have not been tuned into. For those of you in the back of the room, I'll try to explain this. For those of you in the front, maybe you can read it. If you look at the U.S. population that is offered health insurance by their employers, so this is people who have a health insurance offer, 77% of those people are offered one insurance carrier, no choice. So you got essentially one deal, take it or leave it. For those who have a choice, another 8% of the total, let me look instead at the little slice in the middle up in the northwest corner. For about 9% of those people, they're offered health insurance choices. You can have more than one insurance carrier, more than one plan. But whichever of those plans you choose, the employer pays the whole thing. So in other words, for the employee, it makes no financial difference which plan you choose. I've spoken to some HR reps from companies and asked them, you know, when confronted with 3 health insurance contracts, you know, I'm sure you all read health insurance contracts along with murder mysteries for recreation. When confronted with 3 health insurance contracts, and people look at them and they can't figure them out and they can't make up their minds what they want to choose, do you get the sense that it's ever the case that your employees will look at them and say, well, this one is the most expensive one, so it must be the best, and that's the one I'm going to take? And every HR VP I've spoken to has told me it happens all the time. So think about it. What you're doing is you've got a bunch of people who are looking at health insurance choices, and there's an incentive, at least in their minds, to take the most expensive plan. That is not like what happens in any other market. When you go out to buy a computer or you go out to buy a car, you don't think, well, this one's more expensive, so I'm going to buy that one. It's driving, the way the system works is driving people towards more expensive choices, or at least telling them that whatever choice you make, it doesn't make any difference to you. So have a good time. Bottom line, therefore, is we have a health insurance market in which individuals either have no choice or have no reason to choose on the basis of value, on the basis of getting quality at a reasonable price. And because that's true, you have health providers who have no reason to worry about the cost of what they're offering. And you have situations where it's in the interest of a doctor to tell a patient who comes into his office that that person needs 5 services when he only really needs 2, because somebody else is going to pay for it and the doctor gets to collect 5 fees instead of only 2. So that is part of the reason why we have a healthcare system that is driving us towards higher cost, is not dreadfully concerned with value, and probably in the bottom doesn't care very much about quality either. So we have to try to fix that system. Now, how are we going to do that? I will tell you one thing in my remaining minus 30 seconds. When I talk to HR vice presidents of corporations and I say, you're always saying that health insurance is bankrupting you and it's very expensive and it's a big problem and it's hard to manage. Why do you want to keep that system? And many of them do. I basically get 2 answers. One answer is, yeah, it's a lousy system, but I work for a big company and we're good at it. And so I can come up with a good health insurance package and I can use that for recruitment and retention, and I can beat out the small businesses and I can give people a reason to come to work for us. So in other words, they're telling me they've got the best cabin on the Titanic and doggone it, they're not moving. The second reason
that I hear, and this is one where I think for public policy thinkers it's an important burden. They will say, yeah, it's a bad system, but at least I've got the controls. And if our costs are going up, I can make my employees pay a higher share of the premiums. I can increase deductibles. I can increase co-payments. I can refuse to insure the kids. There are things that I can do to try to reduce my cost. However, if instead we have a federal government-driven program, what's going to happen is that the great unwashed out there are going to vote to expand the benefit package and to pay for it with taxes on employers that I'm going to have to pay. So one of the things that we have to do in thinking about where we're going in healthcare is to create institutions that reassure people that while attempting to pursue quality, we are also going to try to keep costs down. And ultimately, as Len said earlier on, we have to keep costs down, because if we don't, nobody's going to have workable insurance, including the people who now think that they're very secure. I'm sure that there were a lot of people 6 months ago working for automobile manufacturers who thought that they were insured for life and they had absolutely nothing to worry about. So long as the system is not financially sustainable in the long run, we're all in the soup. So that's a problem we've got to solve. And thank you very much for your attention, and we'll see you for questions. Am I the only one with slides?
I don't have slides.
You don't have
I do.
You do, okay.
Hi. I want to thank Len for asking me to come here today. I'm going to focus on the impacts of the current economic downturn on Medicaid and S-CHIP programs, the other big entitlement that actually is very affected by economic circumstances, much more so than Medicare. And I'm going to make three major points. First, given that so many Americans depend on the employer or employers for their source of insurance coverage, the fortunes of Medicaid and S-CHIP and employer-sponsored coverage, or ESI, are inextricably linked. In boom times, ESI grows and reliance on Medicaid and S-CHIP coverage shrinks. And the converse, during economic slowdowns, the reverse happens, and reliance on Medicaid and S-CHIP coverage grows, or at least there's pressure on those programs. Second, given that Medicaid constitutes about a fifth of all state spending, and given that states, unlike the federal government, have to balance their budgets in good years and in bad years, states are under tremendous pressure to cut back on Medicaid and S-CHIP during recessionary times, precisely at the time when the need for the programs is growing. And finally, greater federal support for Medicaid during economic downturns, which is being proposed right now as part of the economic stimulus package, and was actually implemented. We have experience with this in the last downturn that happened earlier this decade, can help states avoid deep cuts in their Medicaid programs and act as a countercyclical force in state economies, lessening the adverse impacts of the downturn. So let me talk about each one of these in turn. First, there's really strong, I'd say unequivocal evidence that the need for Medicaid and S-CHIP grows during recessionary times. Medicaid and S-CHIP, as you probably all know, provide a social safety net for low-income children, and to a much lesser extent, but still an important extent, for low-income adults. Almost all states cover children in Medicaid or S-CHIP up to 200% of the federal poverty level. When we have an economic downturn, there are more kids in that income band who qualify for coverage, and more kids who lack employer-sponsored coverage and need that coverage. While Medicaid and S-CHIP programs have much less generous coverage for adults than for kids, they still cover many poor adults, particularly those adults raising minor children. Altogether, Medicaid and S-CHIP cover about 45 million children and non-elderly adults, mostly in low-income families. Numerous very carefully econometric studies that examine the impact of economic conditions on insurance coverage find that when unemployment rates increase, employer-sponsored insurance coverage declines, which in turn leads to an increase in enrollment in Medicaid and S-CHIP coverage. A recent study by Stan Dorn and colleagues at the Urban Institute estimates that for every 1 percentage point increase in the unemployment rate, Medicaid enrollment rises by 1 million. And the breakdown is about 600,000 more children, about 400,000 more adults, and that's reflective of the eligibility policies that favor kids. And the flip side of that is that many more adults become uninsured during recessionary times. And then if you stand back and look at the implications for Medicaid and S-CHIP spending, their estimates suggest that a 1 percentage point increase in the unemployment rate in turn increases Medicaid and S-CHIP spending by about 1%. Now, over the past year alone, the unemployment rate has risen by almost 2 percentage points. The unemployment rate now is at the highest point it was during the previous recession. So we don't have up-to-the-minute statistics on insurance coverage. That's a frustration. But if this model's anywhere in the ballpark, we're going to see at least 4 million Americans losing ESI in this last year. And in turn, greater pressure on Medicaid and S-CHIP programs. And if the unemployment rate continues to grow over the next year, and some projections have the unemployment rate reaching as high as 9%, the demand for Medicaid and S-CHIP coverage is really a whole order of magnitude larger. Second, just as there's strong evidence that the need for Medicaid and S-CHIP grows during economic downturns, those are precisely the times when states are not in a position to absorb budgetary increases. During economic downturns, state revenues also shrink. Recent estimates suggest that a 1 percentage point increase in the unemployment rate leads to a 3 to 4% decline in state revenues. And this particular downturn may have more profound declines in state revenues because of the nature of it. We'll have to see how that plays out. But it's a pronounced effect on state revenues. We already know that 31 states are facing mid-year shortfalls in FY09 that total over $20 billion. And even more states are projecting shortfalls in their FY 2010 budgets, and the shortfalls they're projecting are greater than what they're projecting for '09. When state revenues decline, it really forces states to look to places to make budget cuts, since states can't run deficits, they can't print money, and since all but one are constitutionally obligated to balance their budgets. Given their prominence in state budgets, Medicaid and S-CHIP programs are a logical place to look for budget savings, since they constitute about 20% of all state spending on average, and since they're the single biggest budget category behind education in most states. In the last downturn earlier this decade, all states made cuts to their Medicaid and S-CHIP programs to one extent or another. And given where we are in this recession, states have already tapped their rainy day funds to a large extent and have already taken advantage of sort of the low-hanging fruit. And now they're looking elsewhere for where to make cuts. 17 states now are looking at or proposing eligibility or access cuts for children and families in Medicaid, and 15 states are proposing cuts in services for the elderly and the disabled. But the really tricky part is that the federal-state matching structure for Medicaid and S-CHIP means that states have to make very deep cuts in their Medicaid programs to really save much in terms of state dollars. In the best-case scenario, for every dollar they cut, they save just 50 cents in state spending. But for poor states that have more generous federal matching rates for their Medicaid programs, every dollar that they cut in terms of a service or savings in the program at large can translate into as little as 25 cents in terms of state spending that they've saved. So to achieve meaningful savings in Medicaid and S-CHIP, states really need to make deep cuts. And when they make such cuts, it in effect magnifies the adverse effects of the downturn. And then I want to point out that given how close this downturn is occurring to the last one that occurred earlier this decade, state spending had not returned to its pre-2001 levels, which means that the states had kind of made the easier round of cuts already and hadn't kind of gotten to a point where they had more generous eligibility or service or payment levels. So what can the government do to help? During the last economic downturn, the federal government provided states with an across-the-board increase in the federal matching rate over 5 quarters. And they did that on the condition that states met a maintenance of effort requirement related to their eligibility levels. While the assistance was late in coming to states in terms of the recession, it didn't kick in until the second quarter of 2003, when many states were already beginning to pull out of the recession. And while all the states received the same increase in their matching rate, independent of their circumstances in terms of how bad the recession was affecting them, analyses of state spending patterns that looked at all 50 states suggest that at least half and probably more took advantage of that increased federal funding for Medicaid and made, as a consequence, made fewer cutbacks to Medicaid and S-CHIP than they would have otherwise, and it prevented them from, and they actually rolled back on earlier cuts that they'd made earlier in the recession. Many have argued that a countercyclical funding mechanism should be built into Medicaid and not just discussed every time we face a recession. In fact, Senator Baucus included such a provision in his white paper on healthcare reform that came out a couple weeks ago. And the idea would be that states would automatically receive a greater federal match during recessionary times, though, as you can imagine, there are debates about the specifics of what should trigger an increase in the FMAP and how funds should be targeted across states. In the context of the current recession, the governors have requested an additional $40 billion in federal support for their Medicaid programs over the next 2 years. And by all accounts, the economic stimulus package that Congress is putting together for the new president includes a substantial increase in federal funding for Medicaid. The timing is really critical, that it happen early next year, because state legislative bodies meet early in the year, and they'll be discussing not only how to address the 09 shortfalls, but they'll be making plans for 2010. And if they know that money's coming, I think they'll make different decisions about whether and how much to cut Medicaid. So there are a lot of specific issues in terms of the trigger mechanism, and they're in play right now. How much additional federal funding will be provided, how it will be distributed across states, and what type of maintenance of effort will be required. But there's a consensus that a large infusion of federal funds is needed. And I'll just close by saying that to the extent that Medicaid, this incredibly important program in terms of our low-income families and children, and our disabled and our elderly, really our most vulnerable members of society, to the extent that it continues to rely for such an important part of its funding on state-level funding, we really do need to think about building in a countercyclical federal funding mechanism for Medicaid and S-CHIP that would occur automatically, and that we wouldn't have to dither every time we face an economic downturn about how much and when. We should really think that through. And the pushback on that is that it could lead states to be less fiscally responsible during good times, and I think there's certainly concern about that. But the flip side is to have a program that is needed for low-income folks, and that where the demand goes up during recessionary times, where the funding mechanism is not matched to that, is just structurally unsound. Thanks.
Okay, so thank you, Joe and Jenny, for your great presentations. And what? Oh, my boss here is giving me instruction while I'm... Okay, so, and thanks to all of you for sticking with us through this day, and I'll be quick. During the campaign season, we heard candidates on both sides of the aisle talk about their domestic priorities for our country. Yet, in the month following the conclusion of the campaign, a number of people have speculated that some of the president-elect's domestic priorities, specifically health care reform, would have to make their way to the back burner in favor of the more pressing needs of the economy. And while it is certainly the case that we must take immediate action to stabilize our economy and shore up our nation's housing and financial markets, this does not preclude us from taking on our nation's healthcare crisis. In fact, the economic crisis may make it more urgent that we fix our U.S. healthcare system. So rather than talking about if we can afford healthcare reform, we should be talking about if our nation can afford the costs associated with failing to fix our healthcare system. So today I'm going to lay out some of the costs of doing nothing, the economic impact of the status quo, and some of the prospects for reform. So a while back, the Institute of Medicine estimated that the U.S. economy lost as much as $135 billion in 2001 because of the poor health and shorter lifespan of the uninsured. Since that time, however, we know that a couple of things have changed. One, we know that there are more uninsured Americans, and two, the value of economic output has increased. So in a recent report, my colleague Sarah Axine updated those numbers and found that the U.S. economy lost as much as $207 billion in 2007 because of lost productivity stemming from the poor health and shorter lifespan of the uninsured. Now, that's a pretty big number, and I'm a little scared of big numbers, so let's think of it this way. If you take that $207 billion and divide it up by the number of uninsured people, you get a little more than $4,500. And what's interesting about that is that this is more than the average cost of an individual insurance policy. So in other words, our economy is foregoing more economic value than it would cost to make sure every American had quality, affordable health coverage. So right now, we know that healthcare costs are growing faster than wages, and they've been doing so for some time. This will continue to happen if we don't act, which will make healthcare more and more unaffordable for more and more American families every day. Today, the average cost of a family employer-sponsored insurance policy is a little more than $13,000. Fast forward to 2016, however, and we project that that same premium will be more than $24,000 and represent 45% of median family income. So let's think about that for a minute. That means that half of American families would have to spend more than 45% of their income to buy health insurance for themselves and their families. Another trend we see, and something that Joe touched on briefly, is that when it comes to health insurance, Americans are paying more for less because deductibles and co-payments are rising in addition to premiums. In 2016, we project that the average household will have to spend almost $2,700 in addition to their premiums before their insurance begins to pay for their medical care. And so all of this data is available on our new State of State Health website and in our Cost of Doing Nothing report, which I believe is in your packets, and on our Health Policy Program website. So we don't have to look into the future to see that failing to fix our healthcare system is costly. In fact, perpetuating the status quo also comes with a price. Worker contributions to employer-sponsored health insurance are also rising. Between 1999 and 2006, family employer-sponsored health insurance premiums rose by 88%. During that same period, worker contributions to employer-sponsored health insurance rose by 102%. In the end, this means that as healthcare costs continue to rise, employers are asking employees to bear a greater and greater share of the healthcare burden. We also know that today the insured pay higher premiums, somewhere between 3 and 11% higher, to pay for the medical care of the uninsured. This is because when medical bills go unpaid, providers raise rates for services. In turn, insurers raise premiums. So as Joe laid out, employers are increasingly concerned with rising healthcare costs, but here are two more statistics. Recent work from Len Nichols and Sarah Axine found that U.S. manufacturing firms pay more than twice as much for healthcare as their trading partners, $2.38 per worker per hour versus 96 cents. Also, we know that the uninsured are more likely to be sick unnecessarily for prolonged periods of time, and that a majority of the uninsured are connected to the workforce in some way. James Collins, in the Journal of Environmental and Occupational Health, found that poor health reduces work hours by as much as 1/5, which adds up to as many as 4 days a month. So if you think about that, and you make the connection between health insurance and health, that statistic is particularly powerful. So we've heard a whole bunch about how healthcare costs are impacting state and federal budgets, so I think I will skip this for now. And finally, we know that we do not always get high-quality care for our healthcare dollar. Repetitive testing and preventable medical errors cost our system money. In fact, the Institute of Medicine estimated that preventable medical errors cost our economy as much as $50 billion a year and our society as many as 98,000 lives. So what are the prospects for comprehensive health reform? Should we believe the cynics? Well, I think there is a lot of evidence to suggest that this issue is here to stay despite what's going on in our economy, and maybe, in fact, because of it. First, the president-elect made healthcare reform a top priority for his campaign, even as the economy worsened. He has also said repeatedly that he views comprehensive healthcare reform as part of a broader strategic vision to shore up the future of the American middle class. We also know that healthcare and the economy are two issues that broke decidedly for the Obama campaign on Elections Day. And what this means is, to some degree, that people's concerns about the economy are really about healthcare, and that exit polls indicate that voters overwhelmingly favored President-elect Obama's plan to Senator McCain's plan. And so the American people are ready, and they're expecting some action. Congress is addressing this issue already. This is not to say we're going to have a vote on the Senate floor in the first 100 days of the new administration, but I think you can expect to see the legislative planning process get underway in a real way right away. And as Julie mentioned, the good news is that it appears as though both Senator Baucus and Senator Kennedy have made this issue their #1 priority. We also have bipartisan, bicameral legislation in the Healthy Americans Act, which really helped elevate and build momentum for this issue over the past year and a half. And finally, again, as Julie mentioned, we have a number of initiatives and coalitions emerging that indicate many groups previously opposed to healthcare reform are actually coming out and saying no is not good enough this time. So in conclusion, I think the chances of action are high, as they should be, because the cost of inaction is higher.
Well, thank you very much, and I'm very glad that it's Friday and almost happy hour, because that was just depressing stuff. But thank you very much to our distinguished panelists for making that incredibly clear and producing all those fantastic statistics. I'd like to open it up for questions. We would invite the press to start first, because we like our friends in the press, and we want to make sure that they feel welcome to ask the first question. Do we have any members of the press? Well, then, we like the rest of you, too.
Hi, I'm Bob Anderson. I work at OMB. I used to work for Joe. And I want to have I want Joe to put on his old hat as the chief economist at OMB, and in listening to all kinds of proposals to spend more government money. And granted, next year we can probably put that on the deficit, but that won't work for too much longer. And I know you were always pretty concerned about maintaining a responsible federal budget when you were our boss. Aren't we headed for a huge tax increase in about 2 years? All of this is done?
Just for the folks at home, the question is, aren't we headed for a huge tax increase in the next 2 years to pay for all these wonderful ideas?
Under current policies, outlays are projected to rise in ballistic fashion. That, of course, means that debt increases, which means that debt service increases, which means that debt increases, which means that debt service increases, et cetera, et cetera, et cetera.
It was a yes or no question.
Sounded like an essay. It seems pretty clear that once we get through this period when we're basically trying to make sure that we're going to have an economy 3 years from now, we will have to face up to the consequences of, number one, the accumulated debt, and then number two, the rapid increases in healthcare costs, of which the federal government bears, I guess it's about 40% right now in total. CED has a statement that we issued a couple of years ago in which we suggested that the way to deal with this problem was to simultaneously reform the income tax and add to that a value-added tax to help to hold the debt down while we try to figure out how to cut off the exponential growth of healthcare costs. So we're on record to suggest that in the longer term, we are not going to be able to deal with the costs of a growing elderly population unless we have higher revenues. So I guess the answer is yes.
There you go. And obviously you're not running for president, Joe. Yes, sir.
Yeah. Ben Weil from Congressional Quarterly. And I think this is mostly for Jenny, but maybe Elizabeth too. So Congress is going to have to reauthorize S-chip. I think it's in March of next year, and that shouldn't be very difficult with a Democrat head to the White House. But how does that play into attempts for larger overhaul of the system?
So the viewers at home want to know from CQ if the S-chip reauthorization is going to happen sooner than later and easily. Is that fair?
And how it affects, makes it easier or harder for a broader overhaul?
And will it make it easier or harder for a more comprehensive healthcare reform package?
So I'm not the best person to talk to the politics, but I'll tell you from my vantage point. What happens in March 2009 is that the program funding level is, so the program expires. So no one thinks that it won't be extended. The question is, will it be fully reauthorized? Or will additional funds be appropriated to keep the programs going at the current levels? I don't have a crystal ball, but I'll make two observations. It used to be the case that advocates for all-out healthcare reform felt that the incremental steps we were taking somehow interfered with, delayed, put off, really addressing the bigger problems in the system. I don't see that case being made right now. I think there's a understanding that there seems to be a consensus that it's not a zero-sum game. You can address S-chip in the short run. You can, especially I think, given the growing, and this is even true this year, which is shocking, but the real support at the state level for moving ahead with covering children. I think politically it would be a powerful win for the new administration to have an S-chip reauthorization. But I don't know that it'll be a 5-year reauthorization. I think that could be the compromise, that it's a shorter reauthorization, long enough to give states confidence that if they move, there'll be federal funding there. So maybe 2 years, 2.5 years. But that would be more on a track with and consistent with a healthcare reform at the federal level that included a phased-in approach, and with pieces coming in. I think it is one argument that I've heard, and the S-chip piece could be viewed as one piece of it.
A couple more questions, sir.
Yeah, Paul London. Julie made an interesting comment. She said she's not a political expert in this area. And I have a question. I mean, I wonder whether we're all so sure that the American public is ready for this. But I have seen data that says about 80% of Americans think they have pretty good health care. They're more or less satisfied until they have to go to the doctor, but most people don't go to the doctor. Most people think they have pretty good health insurance. There's a lot of talk here about people who don't have coverage. But I think maybe, Julie, next week or something, you ought to bring in the political experts about this and have them talk. I mean, Hillary Clinton collapsed the whole health care program of the Clinton administration. Collapsed not because there wasn't a plan, not because all sorts of people don't have plans, but because the politics didn't work. Now, I agree with everybody up here that the politics is a lot better now than it was in 1993. Obama has a huge open field to run in. compared to the very narrow one in which the Clintons had to go.
But is your question that we are not ready as a people?
Are we really ready? When the costs come in, when people have to, everybody has Obama has a program where he says, you can keep the insurance you have. A lot of people will want to do that. So, you know, we have to really start talking not so much about all these different plans, but about the politics of doing this. Now, I'm sure somebody's doing that, but I haven't heard very much of it here.
Well, Elizabeth Carpenter, what do you think? Are we ready as a people for comprehensive health care reform?
Well, I mean, you obviously bring up an interesting point that was made central by both Senator Clinton and President-elect Obama in the campaign. That was, if you like what you have, you can keep it. But there is kind of a disconnect here because people want to keep what they have, yet they're unhappy to some degree with what they have. I mean, polling shows that healthcare is a priority for a lot of voters. So I think the key politically is going to be to find a way, one, to prove to the insured voter that investment in healthcare is going to lower their costs over time, but then two, to demonstrate to them that delivery system reforms are really going to improve the quality of care that they receive. And I think that's something else that you're seeing more and more people are encountering some of the cracks in our healthcare system. And you know, I don't think that everyone's ready for the entire system to be dismantled tomorrow, but I think some of them are ready to begin to lay the groundwork for a more efficient system that's going to serve their families better than the current one does today.
Let me just make one comment. You had a figure up there that came from 1999. That figured 48,000 to 98,000 people injured. There's much more discussion of all the things we don't have in healthcare than with these kinds of problems. I think until you negatively frame, so something that the Institute of Medicine talks about, negatively frame the healthcare system, until people understand how bad it is, we're never going to get reform.
Well, and that's complicated to a degree because what, you know, if you go back to the political stuff, people like their doctors. So it's really about communicating to people who have insurance, who like their doctors, that, hey, we're going to help let their doctors spend more time with them, make their doctors' lives easier, you know, fill out less paperwork. And really the case for quality is the case for the insured middle class. And, you know, you've hit the nail on the head as far as we have some real work to do in that respect, but I think there's a compelling case to be made. We just have to work on making it.
Thank you. I'm sorry. I think we have to move on. We're just really pressed for time. The lady in the purple and then the lady in front of her.
Sonia Michelle, I don't see how Obama or anybody else can promise people that they can keep what they have when, as several of the speakers pointed out, employers are shedding their plans, you know, by the day or reducing them. And you know, has anyone done? I mean, I know that some economists have done the calculations and showed that single payer plan is obviously much more efficient and much less expensive. I imagine that. I assume that's off the table, unfortunately. But I mean, the other player that we haven't really talked about is businesses here. I mean, are they going to really go along with all of these reforms that are being suggested?
Joe, are employers really going to go along with what President-elect Obama has suggested, that people get to keep their health insurance?
I think these two questions are linked together to some extent. The environment is changing somewhat over time. Most people with insurance like the insurance they have, but fewer people have insurance. And more people who have insurance know people who don't have insurance. And I always wind up telling the personal story of having two daughters. I had wonderful health insurance as a federal employee. My daughters grew off of it, graduated from college, went to work for small businesses that did not offer insurance. And so, yes, if you ask me, are you happy with your health insurance? The answer is yes. But I stayed up, I was awake in the middle of the night worrying about my children. And I think that is an increasing phenomenon even among many people who do like the children, who like the children they have. The rest of you, I'm sorry.
But if you work for a private employer who is under no mandate to keep his or her their insurance, you may like it fine, but you may not have it tomorrow.
I think essentially the question is the government doesn't have control over private employers, so what do you do about that?
Well, it depends on the system that you create. Senator Clinton and Senator Obama went to some pain to try to put forward proposals under which an employer who wanted to continue to offer insurance could do so. That is a relatively complicated thing to do. If you ask people in the rank and file of the nation, would you like to have the federal employees health benefits plan? Most people would jump at it. You've got a wide range of choices. There's going to be something in there that's going to enable you to keep your doctor, keep your hospital, and many people would be happy with that. So suppose that you came up with a system that said, all right, we're dealing your employer out of it, but you're going to get to have a menu of choices like the Federal Employees Health Benefits Plan. You'd have many people who would say, I'm willing to go away from my employer's plan to do that. So now all you have to do is convince the employers to let go. I believe that the environment there is changing somewhat as well. Many employers still like the idea of the recruitment and retention device. It's a bad system, but I can do it better than my competitors. However, I believe that some are coming to the conclusion, if I look down the road 5 years, we're heading for the wall and I don't know how to avoid it. And so I believe that you're feeling the earth moving a little bit under your feet on this one.
And with that, I'm afraid we have to end. I'm sorry, I'm sure the panelists will be more than happy to stay for just a couple minutes to answer some questions. But we thank you so much for coming today. We think this is a great program, but we really appreciate your participation.
So you got that.